Hello, good morning. Please, we are about to start. We're already behind time. So please, those at the back, kindly move forward. Some people will be coming so that they will occupy the back seat, so that they don't have to be crossing you when they are entering. So please, just kindly come forward. So we are already behind time. So we want to start with the program. I'm sure we are all aware of why we are here this morning. We have a symposium on front of pack label and nutrition profiling model. We have all the experts here. They will take us through what it means. So we have all the experts here from academia, from our clinics, those who see the patients, they know what is happening. And then those in academia who are doing the research, they'll come and tell us what is happening. And those who are in the area of advocacy and policy will also come and tell us what is happening when it comes to the area of labeling, in terms of what we see on our foods. I'm sure we are all concerned about our health, public health. And those in the clinics are telling us some conditions are on the rise. And what we eat has a role to play in that. And those in academia have done research. They are telling us, or they've been able to identify some particular foods that have a role to play in those conditions. So they will be here to share with us. And those in the area of policy also come and tell us what they are also doing to protect our health. So without wasting much time, we'd want to start with the program by inviting our distinguished professor, Professor Christian, my own HOD, Professor Christiana Insia Asamoah, to give us the opening prayer. Please let's give that to Prof. Okay, Prof, you're welcome.
Okay, shall we share a word of prayer? Heavenly Father, we thank you for the gifts of life. Thank you for the opportunity to have this symposium. We commit it into your mighty hands. May your presence be in our midst. Come and guide us in our discussions. We pray for all the presenters. May you grant them utterance, and may you grant a successful program. Answer prayer in Jesus' name. Amen.
Thank you very much, Prof, for the wonderful prayer. So I'll give it to my co-MC to take us from here. Thank you very much.
Thank you. Good morning. Welcome once again. And so at this point, I'll call on our own Dr. Jessica Yensu to come and introduce the dignities for the day. Thank you. Let's welcome her with a round of applause.
Thank you. Good morning again. Welcome and thank you for joining us this morning. So I have the privilege to introduce our invited guest for this morning's program. So we have with us Professor Kingsley Preko. He is the Vice Dean of the School of Medical Sciences, UCC. And we have Dr. Agnes A. Anane. She is the Central Regional Health, from the Central Regional Health. Please, if you are here, kindly occupy the seats in front for us. Then we have with us Mr. Eric Anku. He's a registered dietitian at the Central Regional Teaching Hospital. Then we have Dr. Lauren Boateng. She's with the Department of Dietetics, University of Ghana. Then we have Mr. J.C. Ochre. He's with FDA. Mr. Ochre, please, if you are here, please take a seat in front. Then Madam Nina Asari from FDA. We also have Madam Baba Sam from Sen Ghana. She's here. We have Madam Celestina B. Jacobs. She's from the Regional Health Directorate in Central Region. We also have with us Madam Rahel Mensah. She's the Regional Nutrition Officer. Then we have with us Dr. Nanama Frimpong, Frimpong Japan, Department of Nutrition and Dietetics, UCC. So to introduce our chairperson or chairman for this morning, we are honored to have with us Professor Sebastian Eliasson. He's the Dean of the School of Medical Sciences. Please join me to welcome our chairman for today's program.
All right. Thank you very much, Dr. Ayesu. So at this point, we'll call on the Vice Dean of the School of Medical Sciences, and then who also doubles as the coordinator for this particular program, our own professor. And so would all welcome Professor Preko with a round of applause. Thank you. Let's welcome him. Professor Kingsley Asare Preko.
Thank you very much, Dr. Poku, and good morning to everyone. My work here is very simple. It's to deliver a short welcome address to all of us. I must say that nutrition is a very important subject matter for development. There can't be any development without proper nutrition. And that stems from a healthier food environment that we find ourselves. We know that there has been a surge in issues of non-communicable diseases across all phases, all cycles of life. And a huge part of the problem could be laid on the issues of our changing diet, our dietary transition. It's making it very difficult for us in meeting our targets of addressing issues of NCDs. There is also key findings that most of these stems from the presence of ultra-processed foods that are in our systems. And it's always very important that we address factors that leads to these things. And one of the key factors, the paradigm that has been identified, looks at issues of upstream and downstream factors. Upstream factors are factors that you cannot control, that requires policy directions, that requires key strategic actions in making sure that people have access to healthier options. The other factors are within your control. You decided not to indulge in foods that are highly refined and all that are a bit in your control, but you realize that the pull on the upstream factors are very stronger, where you are always seeing adverts that introduce you, where you always seeing adverts that is actually calling you to have something that you know are unhealthy for you, where you have little knowledge of what is in the food that you are taking is also a problem. And that brings an important subject matter of ensuring labeling that the ordinary person can understand and make meaning of whatever we want to pick up. And that is why we are pushing for the front of pack warning labels, that ought to be mandatory and not as a voluntary process that industries can choose to do or not. Looking at how important these labels have helped address some of these issues of rising NCDs, some of these issues of unregulated food environment is concerned. This has also trickled down to also affect aspects of school feeding, and many other important benefits have come out of these policies of the food environment. And here we are today bringing us all together to look at the issues of why Ghana needs to have a mandatory front of pack warning label and how useful that would be for us. The academia is seen to be a very important stakeholder, as evidence that we need to drive this process is from us. And it's important we interrogate the matters that are there and also have an understanding and also a position as Ghana strives to come up with a front of pack warning label. So on behalf of the team, on behalf of the organizing team here, my own dean, we're expecting our provost here, but another assignment has taken him off. But on behalf of them and the management of the school, the departments that are jointly organizing this, the Nutrition and Dietetics Department and that of the Community Medicine Department, I welcome you all to this morning's symposium on mandatory front of pack warning label. Thank you.
Thank you very much, Professor Preko, for the refreshing address for this program. So we are hoping that we're still expecting some of the dignitaries to be coming. We are hoping that our provost will be in our midst in the course of the program. We're still expecting some more students from the two departments, from the schools, as in the School of Medical Sciences and the School of Allied Health, to still come and join. For those in leadership positions, the course reps and then the class reps, you're able to inform your colleagues to come. The program will not take so much time, so if they don't come early, they will come and would. At this point, I will take the privilege to call on our chairman for this program. In fact, he's a very busy person. He has a lot on his desk, and to accept to be part of this program today is a privilege to us, and we are happy to welcome the chairman, who happens to be the dean of the School of Medical Sciences of the University of Cape Coast, our own Professor Sebastian Eliassen. Let's welcome him with an applause to give us the chairman's acceptance speech. You're welcome, Prof.
Good morning. Good morning. We are in a nutrition symposium. Haven't you eaten already? You look more brower, Adain. Good morning. This symposium is supposed to be very participatory and engaging. And so when we say something and you have to respond, just respond. Okay, so the Vice Dean, School of Medical Sciences, Head of Department of Nutrition and Dietetics, faculty members, of the Department of Nutrition and Dietetics, faculty of the Department of Community Medicine, School of Medical Sciences, faculty members from other schools and departments, students from the School of Medical Sciences, are they here? Students from School of Allied Health Sciences, are they here? Students of the Department of Nutrition and Dietetics, are they here? Second cycle schools represented, the media, distinguished ladies and gentlemen. Good morning. Good morning. When I ask, I expect a response. Good morning. So I'm very privileged to be invited to chair this symposium. A few days ago, the organizers approached me to chair this function. And I give them some excuses, but they sent a very beautiful lady to con me. I have a lot of receptors for very beautiful women. So when she came, I couldn't say no. So I'm here because they sent somebody beautiful to convince me. If it had been the hard brother over there, I'm sure I wouldn't have agreed. So it is always good to send beautiful women to do that kind of advocacy. So I have a speech that I want to read, but occasionally I'll just, interject with. I don't know how many of us know that era called the Paleolithic era, the old Stone Age, and how people lived in that era. The old Stone Age. We call them the hunter-gatherers. They moved about, they walked. Wherever they found a cave, they slept, and then they continued their journey. They ate proteins from wild animals and whatever. But they kept going and going and going. So even present day, we have contemporary hunter-gatherers. If you know the Amazon forest area, the Amazon area, they are contemporary hunter-gatherers. And those people never suffer non-communicable diseases. Okay? But which is the new Stone Age. That is where all our troubles started. Because at that point, those new Stone Age era, people were now gathering together, forming communities and living together, domesticating animals and so on and so forth. So that was the beginning of infectious diseases and sedentary lifestyles. Okay, people were planting legumes and, household farms and so on and so forth. That is where laziness started. Sedentary lifestyle started. Those days, there were no TVs, and things like that. But that was the beginning of our suffering today. So over time, we transitioned, okay? And note that Professor Prekon mentioned the nutrition transition, okay? And that transition went along what we call the epidemiologic transition. Okay, so we're eating, those days you were eating kontomire, beju fufu kakra, and things like that. And we walked to the farms, to carry our produce, brought them home and ate, and we walked. There were no vehicles in those days, not too many. If there were not too many. So a lot of us walked like the hunter-gatherers. Okay, so sometimes when you get to the villages, they say, oh, yeah, but it's so far away. But they walked. So those eras also did not have high incidences and prevalences of non-communicable diseases. But what do we see today? What do we see today? Fast foods. Grab something. Everybody is busy. Everybody is busy. Now our wives and girlfriends and concubines are buying foods from the stores. If you are there, go to KFC, go to Papaya, and stuff like that. And that is why now there is a high incidence and prevalence of non-communicable diseases. And so the business people are also capitalizing on this, okay, and advertising. Manufacturers are capitalizing on this and producing, all sorts of foods. So sometimes you look at the back of the pack. Okay, now even kokunte, we have it in a pack, isn't it? We have fufu in a pack. We have everything in packs. But those days we used to go to the market with her choices. We pick this, we pick that. I used to follow my mother to the market and she will pick this, pick that, pick that, pick that. Okay, and I used to get so annoyed because she will ask, hey, and she won't buy. And she will go there, and then she kept going. Before she would buy one item, she would have moved around 5 people before choosing. Okay, but now everything is so fast. You go to the shop, it's packed, and you pick it. And the labels are even at the back. But how many of us even read them? How many of us read those packs, those labels behind the packs? Okay, in some other jurisdictions, you have the labels in front. You remember this very popular Surgeon General. Surgeon General says so. Said no smoking. Smoking is dangerous to your health and stuff like that. Other jurisdictions have them, but we don't. Sometimes they say something has no sugar. But by the time you actually analyze it, you see there's so much sugar. Okay? There's so much sugar. And that is why, for me, this symposium is timely. I think it is late, though, but it is timely. Tell your friend it is late, but it is timely. We are in church now. Tell your friend, hallelujah. Tell your friend that it is late, but it is timely. It is late, but it is timely. Okay, the advocacy for mandatory front of package labeling and nutrition profiling. It's late, but it is timely. And that is why I am excited to be part of this symposium so that I can also learn and contribute my efforts to this symposium. So I want to thank you so much for electing me to be chairman of this symposium. We are going to have an exciting time. Anything nutrition is exciting. Anything nutrition is exciting. And we need to participate fully in this. I mean, type 2 diabetes is as a result of poor dietary practices. Okay, I have started eating well now because I am at the border. Okay, and I don't want to get there because I've had the past 1 month, I've had 2 of my good friends amputated as a result of type 2 diabetes. Okay, and we don't want to get there. And that is why good nutritional practices and mandatory front of package labeling, that tells us there is high sugar, there's high pepper, there is high salt, there is high this, there's high that. It's key. Something that is catchy. Okay, so that when you see it, then you decide, I don't want this, I want that. Okay, it is key. And so this symposium is extremely important, and I expect that all of us will contribute our ideas to ensure that we have a very solid policy so that our country will have healthy citizens. I thank you very much. I even didn't read the script. Sorry for the one who produced the script. Thank you.
Can we clap for our professor? Thank you so much, Dean. Okay, thank you very much, Prof, for the nice presentation, and thank you for accepting to be the chair. We have the information that if Mina Sari and then the rest from Food and Drugs Board, if they are here, the gentleman here wants to meet you. Thank you. Asari and Mina. Okay, I think he's seen them. All right, so we'll continue with the program. As we've indicated, the front of package warning and labeling and the nutrition profiling models. That's the purpose for which we are here. But it would be very nice for us to have a gentleman who happens to be the key institution that is in charge of this program. That's the Ghana Academy of Nutrition and Dietetics. And so I'll call on Mr. Julius Evami Agbagba, who is the student rep of Ghana Academy of Nutrition and Dietetics, to give us the purpose for our gathering here, or the purpose for this symposium. Let's welcome him. You're welcome, sir.
Good morning. Mr. Chairman, I wish I can also give this without reading, but I'm the shy type. If I don't read, I'll make a lot of mistakes. So I can only hope that when I grow up, I'll be like you. Professor Chair, permits me to stand on existing protocols. I bring you warm greetings from the president and the entire membership of Ghana Academy of Nutrition and Dietetics. Our president regrets that he's unable to join us, but he sends his sincere apologies and warm regards to all of us here today. Personally, it's a great honor to stand in this place, which signifies the last leg of the advocacy train. The train has been to Legon, it has been to UHAS, it has been to KNUST, UDS, and finally, we are here as UCC to climax it. And I would like to use this opportunity to congratulate Stand Ghana, GAND, our academic partners, the media, for the remarkable work that has brought us to this point. Your dedication, collaboration, and persistence are a proof of what we can achieve when we professionals and stakeholders unite around a common public health goal. Over the past decades, Ghana has witnessed a dramatic shift in its food environment, driven by a surge in the availability and marketing of processed and packaged foods. This shift has led to increased intake of sugar, salt, and unhealthy fats, which are major contributors to the rising burden of non-communicable diseases such as hypertension, diabetes, and obesity. But we know that change is possible. Of course, global evidence shows that these labels help consumers to make better decisions, reduce the intake of these harmful nutrients, and ultimately contribute to a healthier population. Such policies have already made a positive impact in several countries, and Ghana stands at a crossroad where we have to make the difficult decision to follow this trend. The purpose of this symposium is to foster dialogue, share evidence, and build consensus around the introduction of a clear, easy to understand front of pack warning labeling system. Because just having the front of pack warning label is not enough, but it has to be readable and it has to be easy for the consumer to follow. As we climax this important series here in Cape Coast, we want to encourage us to see this as a beginning of another and stronger, more united push towards national implementation. Let us consolidate our shared insights and research findings into a very good advocacy position of a clear, effective policy framework for front of pack warning labeling in Ghana. On behalf of GANT and its president, I urge everyone here, the professionals, academics, CSOs, the media, students, and every other stakeholder to remain committed to this goal. The path ahead, we cannot promise that it will be easy. I mean, there are a lot of people who stand to benefit from the warning label not being there, but we will try our best because the health of our nation depends on the decision we shape here today. Once again, thank you all for your time here, and I wish you all a productive and inspiring session. Thank you.
Okay, thank you very much, Mr. Agbagba, for the purpose statement. So the next on our list is the front of packaging warning and labeling advocacy. That will be done by Miss Baba Sam, who is from the SEND Ghana, Strategic Engagement for Nutrition Development Ghana. So if Miss Baba Sam is around, let's welcome her with a round of applause for her to come and give us her speech. Okay, all right.
Good morning, everyone. My name is Baba Sam, as introduced. I work for SEN Ghana, that's Social Enterprise for Development. I will be making a presentation on our advocacy rationale and why we are advocating for the mandatory front of pack warning labeling in Ghana. Thank you. Thank you. So I have a question. Today is 7th May. Thinking back to the food you've been eating from the beginning of the month to now, from your sugar sweetened beverages to your packaged foods, have you ever thought of how much salt is in the food you are eating? Or how much sugar is in the food you are eating, or even how much fat is in the food you are eating? Have you thought of how much, if the sugar in the food is more, how it impacts your health? And so I know there are a lot of young people here, and it is easier for us to, one way or the other, not care about what we eat. We want food, especially when we are students, we want food that is easy to cook, food that is accessible because we don't have time, and food that has taste, that tastes nice. And so because of our schedule, we end up eating a lot of foods that I would say it's not good for us. But because we think we are young, I mean, we think that diabetes is far off, or we think that having a high blood pressure is far off, or having kidney disease is far off. Maybe it's the disease for the elderly, or when you clock 40, that is when you start thinking about these diseases. But then recently, it has not been the case because our food environment has changed greatly. Our food environment has changed greatly. Our food environment has changed greatly, and so it is easier for us to have access to sugar sweetened beverages. It is easier for us to have access to foods that are high in sugar, fat, and salt. We are saying that non-communicable diseases, that is obesity, diabetes, high blood pressure, heart, kidney and liver diseases, have been on the rise in Ghana in recent years. Experts have attributed these diseases to the unhealthy food environment and lifestyle. We know that right now it is very easy to have access to a sugar-sweetened beverage and packaged food than it is to even have access to fruits. When you go to the market or even the market in the school, sometimes even in the home, at the workplace, but you meet about 4 or 5 shops selling processed and ultra-processed foods before you find the woman in the corner who sells fruits and vegetables. So over the years, it's becoming very difficult to have access to healthy foods, and it's easier to get access to unhealthy foods because they are easily accessible. Even when you go to the villages, it is very easy to have access to sugar sweetened beverages because they've been able to penetrate their way through across Ghana. We are seeing that these are driven by excess consumption of critical nutrients of concern. So we are not saying that eating sugar is bad. In fact, your body needs it. Eating fat is not bad, your body needs it. Eating sodium is not bad, your body needs it. However, over the years, it has been on the ascending. So we are eating more than we should. And there's so much that your body contains, needs to thrive. So it means that your body, even though it needs sugar, even though your body needs fat, even though your body needs sodium, there's an amount your body needs to thrive. But in the recent years, the foods we are being presented with have more than what we are supposed to eat, and we are also eating more than we can. Sometimes you say that, oh, I want to lose weight, I want to lose weight. You start a day or two, then you end up going back to where you started. And yes, it's lifestyle, but then whatever you are surrounded by is what you eat. So if in school you are only surrounded by a lot of sugar sweetened beverages. You are surrounded by a lot of foods that are high in fat, sugar, and salt. That is what you are going to eat. But if you are also surrounded by foods that are healthy, that is what you are going to eat because that is what you have. And so even though it's a disease, it's a lifestyle disease, we are saying that your food environment, whatever food you are surrounded by, plays a major role in determining what you eat. You'd realize that there used to be no KFC in Cape Coast. There was no fast food, or it was even if there was, it was on the low. But recently, it's everywhere. When you go to Accra, it's even worse. And so, and the advertisement is so much that when you think about what to eat, you first think about, okay, if I get KFC, I'll eat. If I get McDonald's, I'll eat. So one way or the other, our food environment is conditioning us in a way that we are tailored towards eating foods that are unhealthy than even thinking about foods that are healthy for us, because we are thinking about the time, we are thinking about taste, we don't have time, it is difficult to cook, we are wasting a lot of time in cooking. And so when you're thinking about your nutrition habits, you don't affected by the decisions you make, but we are saying that the decisions you make are largely affected by the food, your food environment, what you are surrounded by. Okay. So malnutrition in all forms characterizes the nutritional status of the school food of the school-age children in Ghana. Research has found that 67% of school-age children are either stunted, underweight, or anemic. And this is alarming. So if children who 68% of children who are going to school, which means that let's say 7 out of every 10 children who are going to school are either stunted. Stunted means that you are too short for your height. So you are too short. And these have an effect on their productivity. So you have a child going to school and the child is either anemic, underweight, or stunted. It doesn't matter the best school you take the child to. It doesn't matter how good the teacher is. It doesn't matter the effort you put in. The whatever is happening to the child is affecting the child's productivity and the child's ability to process whatever information you are giving the child in school. The child is weak, you are tired, you are feeling sleepy, you always have a headache. So imagine sitting in a class where you are hyperactive or you are tired or you always have a headache. It doesn't matter what your lecturer will tell you. It doesn't matter how good your lecturer is. You are not going to absorb whatever your lecturer is teaching you. So that goes on for children as well, even children in the primary school, that we are saying that malnutrition greatly affects your productivity. It affects your ability to learn. It affects your ability to play. It affects your ability to go on with your day-to-day activities. The government of Ghana initiated the school feeding program in 2025 as a social protection intervention. Most nutrients provided by the school feeding program fall short of the recommended daily allowances. Concerns about the school food environment as either supporting unhealthy food consumption or makes it difficult to obtain healthy food. So we all know about the school feeding program, and the idea behind the school feeding program is excellent. And in fact, the school feeding program has been able to achieve some wins in the form where it has increased school enrollment. But then even if you've increased school enrollment, we are saying that the fact that you are eating doesn't necessarily mean that you are meeting your nutritional needs, because you can just eat anything. You can wake up and decide to eat anything. You are full, but then your body is not receiving the nutrients it needs for it to grow, for it to flourish. And so one way or the other, you see the person, oh, I've eaten, oh, I'm eating, but then you're actually not nourishing your body and you are becoming malnourished because you are just eating anything. But then you need your food to be of good quality. You need the right quantity of food when it comes to the macro and the micronutrients in the right proportion for your body to be able to thrive. So we are saying that yes, the school feeding program is a great initiative, but we are also saying that it's not able to meet the nutritional needs of children. So the children are just eating, but largely the nutrition they need to grow, the nutrition they need to thrive is not adequate. Okay. The goal and objective of our project is the implementation of a policy on the mandatory front of pack nutrition warning label and an evidence-based NPM. The overall goal, or whatever we are thriving for, is that we want the average Ghanaian, whether you're a student, you're a child, you're a market woman, you are educated, you are uneducated, you are an artisan. We want you to be able to take charge of your nutrition. We want you to be able to make informed decisions that is going to help you. We want you to easily identify the critical nutrients of concern, which is fat, sugar, and sodium, so that it doesn't matter whether you don't need to be educated before you are able to make informed decisions about your nutrition. For instance, when you take a pack of a bottle of sugar sweetened beverage. We just drink it. At most, the person will say, oh, the sugar is much or the sugar is not much. Some people even think that when you take fruit juices, I don't want to mention brands. When you take fruit juices, the fact that they've written is a fruit juice means that it is healthy compared to another sugar sweetened beverage, which is not true. So what we want is that the average Ghanaian should be able to identify the critical nutrients of concern. The average Ghanaian should be able to understand what the critical nutrients of concern is. And the average Ghanaian should be able to make informed decisions about their health, so that if you are in an environment where the food you are surrounded by is not healthy, you are able to easily identify it and not just buy it and say because you're hungry you're going to buy it. You should know what is in your food. You should know that whether or not this food is good for me or this food is bad for me. And that is the whole idea around our advocacy initiative. We want the average Ghanaian educated, not educated. When you pick a pack of processed food, when you pick a bottle of processed food, you should know what is in your food. Our advocacy rationale is to contribute to a healthy Ghana through the development of a mandatory front of pack warning food label. Work has already been done in this area, a lot of work. Okay, a lot of work is already being done in this area. So what Send Ghana and Ghana is doing is to just complement the work that is being done and add our voices to it so that the policy is implemented. So we want to complement the existing work on the landscape analysis on the school food environment for effective advocacy and policy development, and follow up on the implementation of the FOPL. So when the policy is being implemented, we want that policy to also be integrated in the school food environment, where when you go to school, the policy is not a standalone, but in the school food environment, we want to make sure that when the policy is implemented, it is integrated into the school food environment. We are working with a number of stakeholders, which includes government institutions, the legislature, academia, civil society organizations. We are working with multilateral systems in Ghana and the media as well. These are our main activities. I will not go through all of them, but then again, like I said, the main idea is to add our voices and advocate and speak about the issues that there's a rise in non-communicable diseases. Experts are saying that it is attributed to lifestyle. It is also attributed to the food environment that we are surrounded by. We want the average Ghanaian to be able to make informed decisions about their health, to be able to easily identify the critical nutrients of concern. Through these activities we will be implementing. Ghana is working in collaboration with Ghana Academy of Nutrition and Dietetics to implement this project. So we are saying that you should always, as a Ghanaian, you should know what is in your food. Thank you.
Thank you. Thank you very much, Send Ghana. So address delivered by Ms. Barbasam. Thank you very much. I know if we had more time, we would have loved to advocate further, but unfortunately, we don't have so much time. At this point, we would call on Dr. Nana Amma Frimpoma Ejapon from the Department of Nutrition and Dietetics to talk about the Ghana food environment. Thank you. Welcome, Doc.
Okay, thank you very much. Please, good morning, everyone. Okay, so like he introduced me, my name is Dr. Nana Mafrimpoma Ejapon. I am a registered dietitian. I'm a member of the Ghana Academy of Nutrition and Dietetics. I guess I have to renew my membership stance, but I'm still a member. I'm a lecturer at the Department of Clinical Nutrition and Dietetics of the School of Allied Health Sciences here at the University of Cape Coast. If you are here, don't be tired of hearing obesity and non-communicable diseases. That is what is driving this entire advocacy. So as someone in academia, I'll be introducing you to the numbers, because our traditional folklore is most of the times narrative, we tend to provide a lot of descriptions, okay? So the purpose of academia is to provide the hardcore evidence so that we'll be able to discuss further and then see how to take it up. Thank you. All right, so I'm presenting on Ghana's food environment. Okay, so food environment, because non-communicable diseases are the leading cause of mortality and morbidity worldwide. But the question is, what is food environment? When we talk about food environment, it comprises the foods, the food spaces that individuals have access to as they go about their normal daily activities or normal daily living. They comprise the nutrient quality, in terms of the nutrients available in the foods, the proportion of the nutrients. It also has a component of price, because price is a very important predictor of food consumption. And even in clinical practice, we say that hypoglycemia is a clinical emergency and not hyperglycemia. So when there is hunger, people want to buy what is available, what they can afford, rather than think about other factors. So price is also a very important predictor in the food environment space. Aside these factors, there are also other external factors that go way beyond the individual. We have factors like the built environment that makes food available or otherwise. So like roads, that can influence the transportation of foods or processed foods from one point to the other. We have trade liberalizations and trade agreements, which can influence which countries can import or export which foods into which countries. So all the multinationals we are seeing here in Ghana, the KFCs, the other multinational supermarkets we see, is as a result of trade liberalizations that has made it possible for these foods to be available within our food environment. And these external factors go beyond the individual. So when we look at the history of food environment research, the United States Department of Agriculture is, one of the first organizations, to start monitoring the food environment within the United States. And monitoring these food environments enable them to identify certain patterns within the food environment of the United States of America. One of the first things that they did was they were able to pick up differences in consumption patterns among low economic and then high economic individuals and households, as well as differences in food environment in high economic neighborhoods and low socioeconomic neighborhoods, And through these research and monitoring systems that the States Department of Agriculture developed or monitored, or the data they collected. The United States was among the first countries to introduce social programs like the school lunch program. I think that these historical perspectives are important to help us appreciate the genesis of the food environment and how dietary intake impacts health and well-being. So aside the school lunch program, they also had the supplemental nutrition program. So the supplemental nutrition program was done for women. Okay, the slides are in now. Oh, okay. Yeah, it is. Okay, so we are on this slide. So you see that the United States Department of Agriculture has been monitoring their food environment over the past 130 years. Okay, and like I was saying, they've developed a lot of social interventions. Okay, and when you compare, it's only second to the United Kingdom in terms of social interventions to improve nutrition among children and vulnerable households. They also have the supplemental nutrition program that they develop for women, pregnant women, and then lactating mothers, okay, who are from low socioeconomic households, to help improve their nutrition. So based on this early food environment monitoring that they did, they were able to develop these social intervention programs. Additionally, I must say that it was also the first country to fortify their foods, okay, in order to curb nutrient deficiencies. And this fortification was adopted by other countries all over the world. And all this was as a result of monitoring their food environment. Okay, so why look at the food environment? The food environment, because non-communicable diseases are the leading cause of death. In 2021, they were related to 75% of non-pandemic related mortality. You know, in 2021, the world was faced with the challenge of COVID-19 in 2019 and 2020. In 2020, and even latter, early parts of 2021, but when the World Health Organization assessed morbidity and mortality, they still found that non-communicable diseases were predominant cause of death, accounting for 43 million deaths globally. Of these deaths, about 80% occur in developing countries like Ghana. So not only are the deaths a concern, the age at which these deaths are occurring are also a concern. Most of them occur prematurely or before the age 20 years. Even in Ghana, our current life expectancy stands at 64 years, okay? It's reduced slightly to 63.9, but when you round it over, it's just 64 years, meaning that we don't even get to the pool of premature deaths averagely. All right, so dietary risk factors are the #1 cause of non-communicable diseases, morbidity and mortality worldwide, meaning that once we control and shape the food environment and therefore dietary intake, we can have significant impacts in population health and well-being. Globally, governments are also overwhelmed by the expenditure on non-communicable diseases. It now stands at 2 trillion United States choppable dollars, okay, which is 3% of the global gross domestic product. And these amounts are very high, considering that the amount we've borrowed from IMF the years is far, far lower than this amount, meaning that the non-communicable diseases are burdening not only our physical and then health status, it's also burdening our socio-economic status and outcomes. Additionally, looking at the food environment is important because we have been able to use food policies to mitigate population health problems in the past. For instance, goiter, which is iodine deficiency, has almost been curbed around the world as a result of compulsory iodine fortification of salt sold in all commercial outlets, okay, meaning that there is still a promise or there is still hope for us to use food environment or food policy regulation to improve health outcomes. So it's something that has been done before, so we can capitalize on that and then use it to enact more policies. All right, so still looking at the food environment, let us look at some recommendations from the World Health Organization concerning what should constitute a healthy diet. So the World Organization recommends consuming whole grains, fruits and vegetables. For fruits and vegetables, it recommends at least 400 grams per day, which translates to 5 servings of fruits and vegetables per day. Less than 10% of calories should come from sugar. And this 10% translates to 12 teaspoons of sugar per day. In fact, some energy drinks and some sugar-sweetened beverages contain more than these 12 teaspoons of sugar per serving, meaning that we have to really regulate our food environment if we want to meet global recommendations on healthy dietary intake. Additionally, it recommends that less than 30% of total calories should be from fats and less than 5 grams, which translates to 1 teaspoon of salt, should be consumed daily. You can easily get that quantity from buying plantain chips or salted popcorn, meaning that there is the need for us to regulate our food environment. Additionally, even if you look at the production side, currently we are just producing worldwide, we are just producing about 70% of the fruits that we need. Meaning that even if everybody has the money to purchase, 30% of the population will still not be able to acquire enough fruits. Meaning the supply side of the food environment should also be assessed in order to advocate for more policies. Also, data from the Food Agriculture Organization shows that more than 40% of the global population cannot purchase or afford a healthy diet. So a healthy diet, when you look at the amount quoted, you translate that to Ghana cedis, that's around 20 cedis per person per day. Okay. Meanwhile, when you look at our minimum wage, it currently stands around 19 cedis, meaning that even if the ordinary Ghanaian wants to use the minimum wage for a healthy diet, they will still be short off by 1 cedi. Okay, so all these data means that we have to search the food environment and provide more policies that will support healthy dietary consumption. Okay, how did we get here? How did we get here, you know, from consuming? Oh. Please, sorry, the pointer. Okay. So how did we get here? So we have what we call the model for the food environment transition. We started, I think that Professor Chairman made some remarks on this when he was making his acceptance speech. We started as hunters and gatherers, okay, where we would just go to the wild, pick some foods. Through experimenting with these foods, we're able to differentiate what is poisonous from what is nutritious, what is, what supports life from what does not. So we started as hunters and gatherers, gathering food from the natural environment, getting our animal source foods from, the forest or even from the sea, rivers, and then other water bodies. Then we moved to cultivation in addition to the wild, life or the wild form of gathering food, where food was cultivated for subsistence. So when we say subsistence, what does it mean? Is that the food is cultivated to provide what nourishment for the household, and the little that is left over is exchanged for other foods or sold to still support food consumption, and that is the level 2. Then in the third level, where there was agrarian societies, informal markets are introduced and foods are intentionally cultivated to be sold, but they were sold through informal channels like wet markets. So you just go to maybe Kotokraba market, you get your tomatoes, you get your onion. That is the agrarian society. Before we moved on to urban and peri-urban settlements, where there is addition of the formal system, and that has eradicated the cultivated and the wild system entirely. So in the fourth one, I know it's not so clear from here, but in the fourth model, you see just the formal and the informal system. In fact, most countries in Europe and the America, they've transited from even the fourth model to the fifth model, where all forms of food are sold through the formal channel, whether vegetables, whether healthy or unhealthy. Don't think Ghana, we are too far. So far as KFC and then chicken man is opposite your school gate, know that we are drawing near to the fifth stage. So this model was proposed by Popkin et al. 2020 at the sixth category, okay? But then the sixth category can happen as a result of what we are doing now, as a result of advocacy that pushes for foods to be cultivated, fresh foods to be cultivated in order to improve the consumption of fruits and vegetables at the household level. All right, so now let's look at the food environment of Ghana. But it's impossible to look at the food environment without looking at population disease characteristics, because what is driving this advocacy is the disease characteristics or the epidemiology we are experiencing. So it's very important and critical that we look at some data on the health situation in Ghana and how it has changed over the years. So adult obesity between 1980 and 2015 has increased by 500%. Okay, that is a very huge increase. Prevalence of obesity now stands around 30%, 20% among women and about 10% among men, okay, meaning that about a third of our population are obese. Diabetes prevalence is 13%, and I think that this prevalence reported here is likely to be lower than what the actual values on the grounds are, because we've not had any national surveys that have looked at, prevalence of obesity, diabetes among the 30 million Ghanaian, Ghanaian population. This is from, surveys that have been conducted, and the average prevalence stands at 13%. Prevalence of hypertension is around 27%, and these are an important risk factors for chronic kidney disease. I know that in recent times there's been, discussions around the impact of galamsey, the recent increases in kidney disease. But if you look at the data we have now, okay, it shows that individuals who present with chronic kidney disease present with the underlying disease risk factors, that is diabetes and hypertension. So I'm not saying galamsey cannot be blamed, but we have to collect hardcore data and analyze the data rather than narrate what is happening. Our healthcare system is overburdened. Okay, we saw what happened at Tamale Teaching Hospital about a month ago. Okay, it shows how overburdened our health systems are. The medical doctors here, the medical students here, we salute your good work. The health professionals, our dietitians, our dietetic students, we salute your good work. Okay, we are overburdened. Our outpatients are so much, we can't handle them. The doctor-patient ratio is so high, okay, way below global recommendations. So even our current health systems are not enough to support maternal child health infections, HIV, malaria. They are not. So adding non-communicable diseases really overburdens the health system. And there is the need for regulation, food environment regulation, research, data, in order to inform healthy food choices. The annual cost of care among obese persons in Ghana is also high. Okay, when you compute the data, obese people spend 1.5 times more than normal weight individuals in healthcare. And you may say, how does that concern me? If you are obese and you are spending more, how does that concern me? The National Health Insurance Scheme, which you contribute to directly or indirectly, bears about what? 60% of the total amount in terms of cost. Okay, meaning that we are all indirectly affected. These monies could have been channeled for what? Roadworks and other developmental programs, but they are channeled to take care of obese individuals in our various health facilities, meaning that our food environment, our dietary intake, our dietary quality is really a challenge. All right, so before we delve into what Ghana food environment looks like, let us first of all look at some measures of the food environment. So when I talk about measures of food environment, I'm talking about how the food environment has been assessed, okay, in Ghana. It will help us to know the lapses that are currently available so that through our research, we'll be able to fill these lapses in order to present more compelling data to advocate for policies. So one of the most common ones used not only in Ghana, but also globally is the Geographic Positioning System, GPS. And I know most of us, technology, I know students nowadays are very technological, and you know what GPS or Global Positioning System is. So that shows the point location of various food outlets. Okay, so what researchers do is that they visit a particular community or neighborhood, then they find where the locations of various food outlets, whether they are supermarkets, whether they are provision shops, whether they sell fruits and vegetables. So that is the GPS. And then in recent times, we have the photo voice. So the photo voice is depicted in the first picture where study participants are made to take pictures, of where they buy food, of things or of food outlets around them, whether school or neighborhood, and provide a description or discuss how these photographs or these outlets affect their consumption. Okay, so we have some studies that have also used just perceptions, okay? So the perception of the study participants where they look at okay. So perceptions where study participants describe in their own opinion. So this is a subjective measure. They describe in their own opinion. So for instance, you'll be asked, do you think foods sold around campus are affordable? Where can you get affordable foods on campus? And these measures have also been used in the Ghanaian context. And like I said, they are subjective measures. All right, so what does the food environment of Ghana look like? Yes, there is penetration of sugar sweetened beverages, but the consumption of out-of-home cooked foods is very significant, and it contributes about 60% of food consumed outside of the home. It's very important for us to know this because it will help us to think about how advocacies like a front of packet food labeling can be tailored to capture these out-of-home good foods because they are very dominant in Ghana from the current data we have available. Poor hygiene is also a concern. Poor hygiene in terms of microbiological contaminants, the physical environment, okay, where foods are sold is a big issue in Ghana, especially in low-income areas. So food provision outlets are also concentrated along major highways. So you see where KFC is located in Cape Coast, okay, along major highways, okay, meaning that there is aggressive marketing, intentional positioning of food outlets to attract the consumer. And low socioeconomic status is a major barrier. So price is the most important determinant of food consumption, whether you believe it or not, okay? Individuals think about what they can afford, what they can purchase with what they have before they start thinking about health impact. So price is a very big thing in the food environment space and discussion. Additionally, especially in the northern part of Ghana, own food production, okay, so farms, home gardens contribute to food security and consumption. All right, so this is data from Dick et al. 2016, who conducted research in low-income neighborhoods in Accra. So you see where the red points are. The red points you see are showing you the location of food outlets, and the red points indicate out-of-home cooked foods in the neighborhood. The yellow points, if you can see from where you sit, are convenience shops, and the green, which are very minimal within the picture here, are for fruits and vegetable outlets. So meaning that in low-income neighborhoods, okay, out-of-home cooked foods are a major source of food. And you should remember that about 42% of the Ghanaian population fall within low-income status. All these things will help us to bring to the fore how poverty also play a role in this discussion of advocacy for a healthy food environment. So in Ghana, the informal sector plays a major role in food acquisition. Traditional markets like, Kotokra, but I don't know how many of you buy fresh produce, tomatoes, garden eggs from the supermarket. So in Ghana, the traditional market is still a vibrant source of food. And now with the penetration of provision shops or convenience stores, even in the traditional market area, people are also able to source ultra-processed foods within the traditional environment space, and it serves as a significant source of food for most Ghanaians. So ultra-processed food and unprocessed foods are available. Okay, so in Ghana, from the data we have, both are available, okay? Maybe in terms of positioning, ultra-processed foods are more visible, but from the data we have, both unprocessed and processed foods are available and their costs are similar. However, when you do further categorization, you see that fruits and vegetables cost higher, and as a result, they are not often consumed. So we conducted research together with my professor. It was published early this year. And then we found that when you categorize consumption of obesogenic foods, young persons, okay, are key buyers of obesogenic foods, all right? So meaning that they should be involved in the discussion because they are one of the key consumers of obesogenic foods in Ghana. So not only young persons, you also found that people of low low education level, okay, so those who don't have high education, maybe just basic school, okay, they are also key purchasers of obesogenic foods like sugar sweetened beverages and biscuits. Then the large amount of food, that is the sad part, that large amount of the obesogenic food we have in Ghana, they are imported from other countries, okay, rather than homemade, meaning that once we are able to target some of these, trade regulations, we can control our food environment in Ghana. So about 85% of Ghanaians, when you look at the sources of food, so in terms of the food environment, I have given you an overview, and I've said that traditional outlets are a major source of food. We know who is consuming obesogenic foods. Okay, now about 85% of Ghanaians purchase their foods from traditional markets. That is the data we have available. And only 35% purchase from supermarkets. And even with the supermarket purchase, you realize that when you compare the frequency of purchase to the traditional market, supermarket purchase has low frequency, even though about a third of the population purchase from there. And convenience stores, okay, referred to as provision shops, they are a major source of ultra-processed foods. And it is through these outlets in Ghana, that is why ultra-processed foods have also penetrated the rural environment. And in fact, Popkin et al. In 2022 published a paper, and they indicated that in most developing countries, the increases we see in body mass index or weight is as a result of increases in rural areas rather than in urban centers, meaning that we need a lot of policies and advocacies in rural areas as well. They should not be left out. All right, so has any studies been done on the food environment and health? Yes, only a few, but at least we can draw from their evidence, look at the lapses, and then look at where new research can target. So Ms. Baba eloquently expanded on the Ghana school feeding program. Yes, the Ghana school feeding program was introduced in 2005, but the results or findings with regards to its impact on health are mixed, okay? So some studies report that the school feeding has contributed to positive intake of vitamins and minerals, okay? But some found no association, and even some found that there was a negative association between provision of school foods, okay, and other anthropometric measures. Because in some areas of Ghana, these school lunches that are provided replace the lunch at home. Meanwhile, the meals of the school feeding program do not provide the 2/3 of the recommendations, okay, as they should. Meaning that we have to look at the school feeding program again. The school food environment is predominantly unhealthy. Of convenience foods are available. Even where healthy food is available, the distance between the healthy food and the school, okay, and the time permitted for break, okay, presents as a barrier to purchasing healthy food. In Ghana, we also have a policy on fatty meat. So this fatty meat policy was implemented in the early 1990s to curb the importation of fatty turkey tail, okay, into the Ghanaian market. At the initial stages of the implementation of the policies, we saw some reduction in fatty meat imports, but as at now, we realize that there is still, some influx somewhere, meaning that we have to also strengthen our implementation measures. Convenient foods positively contribute to BMI. So Dick et al. In their research, they found that in neighborhoods where there are lots of convenience shops or provision shops, these provision shops influence the population body mass index. What barriers exist? Okay, when we know the barriers, we can what? We can clear the way. What barriers exist to the consumption of healthy food in Ghana? And like I said, this data I'm presenting is based on a systematic review we conducted, okay, to pull together the evidence to influence the food-based dietary guidelines. But I know that this evidence are compelling and are key, okay, for any advocacy programs like we are having here today. So the key factor is socio-economic, okay? People know what is healthy, all right? Annan et al., okay, found that people know what should constitute healthy meat. Because of cost, they still purchase unhealthy meat products, okay? So cost is a very important barrier. Then we have lack of storage facilities where people don't have cold storage facilities, or even when there are concerns about lies out, okay, that would impact how long these perishable fruits and vegetables can be stored. So that also, influence populations and households to opt for unhealthy food options. Food seasonality has also been mentioned, and there's also a big issue around contaminants contained in fruits and vegetables. People ask a lot and are concerned. Fertilizers are being used to produce these fruits and vegetables, but fertilizers are used to produce most staple foods as well. But when it comes to fruits and vegetables, because most of them are consumed raw, there is a lot of concern around their safety in terms of the chemical contaminants they are likely to contain. Then there is also limited on-farm production. In urban centers, farms have almost been eradicated. They've been used for built infrastructure. So that's also a barrier, meaning that now money, okay, or purchasing is the main source of food. You have to have the money to be able to purchase. There are also conflicting media reports, okay, a lot of conflict within the media, okay. Foods are being discussed. Nutrition is being discussed by people who are not professionals. It creates doubt and confusion in the minds of consumers. And these are all factors they mention that they tell themselves, whatever would happen should happen. I'm tired about the information. Today there is this, tomorrow there is a conflicting information. So that also affects healthy food consumption. All right, so I asked the question, looking at the kind of data we have now, are we ready for a food environment policy? I say yes, we are, but we are not looking at the data. In my own perspective, we are not ready for fiscal measures yet. Fiscal measures has to do with financial measures like introduction of taxes. Okay, looking at the fact that we have a new government, all right, everybody is looking at our president critically, okay, and he's trying to, be in the good books of Ghanaians. Introduction of taxes, I don't think we are ready for. Those are the fiscal measures. But there are non-fiscal measures or non-financial measures that we can capitalize on. Okay, that is why I say that yes, we are ready, but just for the non-fiscal measures. So the non-fiscal measures, yes, like food labeling, okay, if we label and then we do the front of package labeling, we educate the public, then now the public will have the power to decide what to buy and therefore encourage the production of healthy foods. There should also be measures. We can also do a lot of, or we should do a lot of policy advocacy around food hygiene, because one of the reasons why people also opt for ultra-processed foods within the Ghanaian context is the fact that they are unsure about the safety of fresh foods. They are unsure about the safety of cut vegetables. So once the food is packaged, they have this sense of safety. So we have to also advocate or have policies around food hygiene. Then food provision in schools. When you look at the current policy landscape, there is a soft spot for children, and policymakers usually are very soft, okay, and very ready when it comes to policies geared towards children. So we can capitalize on this soft spot and their readiness, okay, to regulate the current Ghana food environment. Okay, we can also regulate advertisements. In fact, that is in the pipeline, okay, to regulate food advertisements for children. All right, so we developed our food-based dietary guidelines. It was launched in 2023 when most people thought Ghana was not ready. But through research and through reviews and through data and grant support, we were able to develop it. So I think that in the same way, it's also very possible to develop food policies that are implemented to ensure improved nutrition outcomes. Conclusion, take home. Teachers, we talk a lot. So when you compare me to the first speaker, you see that I've elaborated the points. But the question is, what are you taking home? Number one, when you were asked, what does Ghana, you said you were going for a symposium. What was said? Your take-home message. Number one, Ghana, we are at the advanced stage of the nutrition transition. We are at stage 4, where we have formal and informal food supply systems. However, the informal sector is still a predominant source of food. If we don't do advocacy, that is likely to change like it has changed for other countries, like just South Africa. Okay, you may say I'm talking about Europe, but South Africa is just down Ghana, and they have, been at the 5th stage, where the formal food system has almost eradicated the informal system. Convenience outlets are important source of ultra-processed food. So the provision shops, you see them in every corner, okay? They are everywhere, and then they are, supporting or supplying and retailing ultra-processed foods. Also, looking at the data available, you see that just like in other African countries, supermarket expansion in Ghana will likely contribute to food insecurity, because survey participants have indicated that the traditional food outlets, they break bulk. They are able to give the food on credit, which supermarkets do not provide. So eradicating the informal system will also result in food security challenges. And I think that currently, based on the data we have now and the research we have now, non-fiscal measures like food labeling are feasible in regulating the food environment. Thank you.
Thank you very much, Dr. Nanama. And can we please do it for her again? Thank you. Okay, so we are now at our Q&A session. And so far, we've heard from Prof. Preku, who welcomed us. We also heard from Prof. Eliasin, who is our honorable chair. We've heard from our GAN rep, who told us about the purpose for our gathering here today. We've also heard from Sen Ghana, where Ms. Baba told us about the advocacy work that they are undertaking. Then finally, from my honorable Dr. Nanama, who has told us about the food environment that we have in Ghana. So now it's time for us to ask them the questions. So please, let's restrict our questions to the presentation that we've had so far. There will be other sessions where we can have the Q&A sessions. So we'll do it this way. We'll take a set of 5 questions, then we'll come to our presenters for their feedback. Then we'll go for, I think, 3 rounds maximum, so that we can continue, because we are already behind time. Okay. Okay, so can I please get someone to help me with it so that we can ask the So we'll take 5 questions and we'll come to our presenters. You can ask direct question or you can ask a general question. So
All
thank
right.
you very much.
Thank you very much. My name is Eric, and my first question goes to Baba. So beyond this symposium or symposia we've had from UG all the way to UCC, what is our digital advocacy strategy to help promote our efforts currently? Do we have a website in place? Do we intend to have one? How can we leverage the podcast systems that are already that is vibrant already in some of the YouTube channels, or even come up with our own channels to maybe promote this effort? Social media campaigns, what is generally our digital advocacy strategy to help promote the effort we are leveraging from here? And then the second and third question goes to Dr. Nanama. She mentioned at a very important point that price is a very important aspect of food consumption, and I agree with that. My thought here is, so then how are food prices regulated to ensure that we are protecting consumers? Because then I've been tracking one particular food item that I often buy for some of my, get for some of my patients, and the price has almost quadrupled in just 2 years. And I keep wondering how these prices are set. What are the mechanisms in place to ensure that these prices are not too high for our consumers? So is there any regulation in place to help protect our consumers? The next one was about the fact that she mentioned that most of the obesogenic foods are coming from outside the country. What are we doing about it? A general question. And then the last one is more of a comment to the department about the fact that there's limited evidence on these food environment situations. We take this up as a research direction to help generate evidence for, the country or even for central region. Thank you very much.
Thank you very much, Eric. Okay, so please let's make it very snappy so that we can take a number. Okay, I can see a hand up at the back, and then there's one also here.
Yeah, my question is about UCC as a university community.
Can you please get up? Yeah.
We've been talking about people consume what's available or what's around them. And we here as students, we most buy from the science market, code, and then the calc. And we go, the other we see is those sweets, beverages, and all kind of food we are saying it's no good for our future health. So as a university community, what's the university doing about that? If possible, can regulate the selling of certain food commodities at those markets for us. And also concerning our prices on campus. When you going to buy the foods we think is the healthier ones, the price they will give it to you, you can't buy. So you offer to buy the sugar ones, which will satisfy you, though you won't get any nutrients from it. So if the university in any way can regulate the price of things so that the university market for us. And also my another question is to the country or to the university department. We are talking about Ghana's food environment. And all these foods we've been talking about, we see advertisements on TV that they are vetted and approved by the FDA. So how does the country tend to fight those foods which are not healthy? If the countries' food bodies have accepted it or have approved it. So how does Ghana, in collaboration with FDA, tend to fight about the Ghana's food environment? Thank you.
Okay, thank you very much. Okay. Please, let's make it snappy so that we can have more questions.
Thank you very much. Please, my question is talking about school feeding program from our first speaker. Please, is there any policy that is monitoring school feeding program? Because the feed that is given to the students are not even balanced according to some of the teachers or some of the people that are monitoring it. So I don't know what the advocacy is doing about it. That is one. And secondly, talking of fruits and vegetables that we take, most of our farmers use fertilizer, which also affects the intake of these foods. So what is the advocacy also doing about it? Thank you.
Okay, thank you very much. So the last two. Okay, there's a lady here. Then we'll come here.
Please, during Dr. Naname's lecture, I heard that convenience stores impact BMI positively, and I wanted to know how.
Okay, so thank you very much. So our last question for this session, for this round, will be
Thank you very much. My name is.
okay.
Is about how my question is about how we can reach out to the villages and areas. We are literate and we know how to read. I'm thinking about so we really thank St. Ghana and GAN for organizing this important symposium. But I want to know if they are striving to illiterate to create a sugar beverage that
Okay. So thank you very much. So we've taken our first round of questions. So the first one was from Adi Eric to Ms. Baba. I don't think. Please, is there any rep from Send? Okay. Okay, so she's coming. Okay. So it is about what are the advocacy strategies that we have. We have website.
Thank you. Currently, I'll give it to our communications persons from GAN, but then currently we are taking advantage of social media platforms.
Thank you very much. So currently we use social media handles. So Facebook, Twitter, Instagram to do some of the advocacy. But some of the other strategies that Eric has stated are quite well noted, like having a podcast channel where some of these messages could be shared is well noted, and we are going to look at it.
Okay.
And how we can implement that.
Okay. So thank you very much. Please, if you can come in so that you don't have to be moving back and forth. Thank you. Okay, so the next question goes to Dr. Nanama from Eric again. He asks about price regulation. Please, yeah. So maybe you can take the two. So he asks about the price regulation and also asks about what are we doing about foods that are coming from outside the country, right? Eric, that was it. And so maybe if you can take the two.
Okay, thank you, RD Eric. RD Eric, please, you know that we all are dietitians, so my role was to present what evidence are available. But with regards to price, there is nothing, okay, or there is no data or government document showing that prices are regulated upstream. Okay, so the only regulations we have on the food environment, one is on fatty meat policy, regulating quantities of fatty meat, regulating breast milk substitutes. These are the two strong, especially for the breast milk substitutes. Aside that, there is no policy or document showing how food prices are regulated in Ghana. We've not found any. So I don't think there is any mechanism. Okay, yeah. And also most obesogenic foods coming from outside the country, I think that that is a very strong policy advocacy point, But there are also lapses in the data because we did not analyze all obesogenic foods. What we did for that project was to identify the key or the commonly consumed obesogenic foods, and we found that that was biscuits and sugar-sweetened beverages. So if you are able to profile, in my own view, if you are able to profile most or almost all the obesogenic foods, then we can make a strong case, okay, in terms of the total quantities, coming outside the country. But now with the current data we have, I think that we are in early days here to advocate for regulation of the external influence. Yes, please.
Thank you very much, Dr. Nanama. I think the last point was more of, okay, so that one we don't need to. Okay, so the next question from a student who asks about what is the UCC community doing about availability and then affordability. So that one, I think I will go to our Prof Chair and then Prof Preku, if they can help us with any information on that.
All right. I think that the person who asked the question asked a very, very sensitive and important question. And part of the advocacy program, we want to look at school food environment as one of these things. There are 4 key policies that are currently under development, which is the fiscal policies, the market restriction policy, and then we have food procurement policy that is also going to regulate procurements that are food procurements within government established institutions, and within that policy, things like the school feeding program that someone touched are going to be addressed in some of these things. What foods you can buy for a school feeding program, where you can purchase these foods, because a percentage of the procurement must be done locally. And all these have some influence on addressing one thing or the other. Importantly, as a university, I believe that we have a public health unit in the university, and I believe departments like nutrition and food science, medical school, and many other departments that are the allied school and all that are running programs should be actually serving on that school public health board, so that we plan and have a tentative program to address some of these issues within our school food environment. We see every year now and then issues of cholera even coming up once a while within the school community, and then we mobilize to address some of these issues. But it is important the school can also come up with policies to regulate our food environment within our immediate spaces, so that our children or our students would not have challenges too. But these conversations must be initiated, and clear pathways would come up. And I'm happy that it is coming from one of our own that is concerned about this. And it's because some of these issues, we have not talked about them so much in our universities. We talk about many different things, but we hardly touch on our food, which is the bane of our problems that we are having in this country and even in this school, because every year you hear people dying, and they die out of conditions that are preventable. And we need a strong health policy to address that within our own immediate school environment.
Okay, Prof, thank you very much. Please, if you can also take this one for us. Prof, so there was a question on whether we have school feeding policy. Maybe if you want to touch on that one too for us.
Yes, there is a policy that guides the school feeding program in its entirety. However, it's about the implementation pathways, okay? How these policies are churned out and the stakeholders that are really brought into running these programs. I know when these things started, it's more like a government-led thing, and then people were consulted to offer services and all that. But key people who were needed in determining what goes on in the school catering processes were the nutritionists and dietitians. And I'm not sure the earlier engagement was that strong, engaging nutritionists within the aspect of the policy. And even now, maybe the nutrition director is here, so she may throw more light onto how they are currently being engaged with to monitor these foods. And I would always say that wherever food is sold or wherever food is prepared within the institutional level, we should have dietitians or nutritionists being, what do you call it, engaged in these industries. Now we have people even running, what do you call it, exercise gyms and all that, wellness centers. But you go and people who are manning the place, they do not have the full requirements of resource, personnel, human resource to man the place. And people are giving all sort of advice. Some will say even it's wrong to eat salt at all. It's wrong to, what do you call it, not to eat salt. You should eat so much salt. It's good for your health and all that. A lot of information is going out there. A lot of information and misinformation is going out there because we are not using the right persons to guide some of these discussions. So I think that as a nation and as a policy, we should incorporate some of these issues within the policies that mandates that the right personnel are engaged right from the word go.
So, Prof, thank you very much. There's a question on the popular phrase vetted and approved by FDA. But that one, we will leave that question for now because the FDA will come. So when they come during the next session, we will ask them that question. I hope that is fine. FDA, okay. So that question will be answered during the next session because the FDA will come here to come and present, then we can ask them. So the next question has to do with the use of fertilizers in our fruit and vegetable production, or that they affect the intake. So maybe any of our presenters, I really want to do as the honest. Okay.
Okay, thank you. You know, for my PhD, the broad title was funded by the International Development Research Center, and the broad title was Researching Obesogenic Food Environment. So after taking the dietary data, concerns about chemical contaminants or fertilizer application came up strongly. So subsequently, we collected some fruits and vegetable samples from open markets in Kumasi, and we analyzed them at the Ghana Standards Authority. Results from our study showed that most of the contaminants were at safe levels, so they didn't go beyond the safety limits set by international regulatory bodies. However, with the Ghana food environment space, there are lots of concern about fruits and vegetables. So I think that I cannot use just the survey conducted in Kumasi to conclude for how safe they are across the country, but we should do a lot of research. Okay, it may be that the problem is there, but it's exaggerated or even not there, or it is even there, but it is even less talked about than it currently is being talked about. So we have to collect more data on that. Thank you.
Thank you, Doc. No, so please, back to Dr. Nanama again. There was a question on convenience stores and then the BMI. So if you want to.
Okay, so during my presentation, I indicated that for the global positioning system, that is the GPS, what you do is that you use the point location, or you take the point location of the food outlet. So for instance, if this is my home, and this is the convenience store, when you compare the proximity of this convenience store to my home and somebody who, let's say, lives further away, okay, what are the influences? So those ones, they are derived from statistical analysis. And we found that when you introduce a convenience store within the neighborhood, okay, it results in 0.2 increase in BMI. So that is data from Dick et al. In rural settlements. And of course, when you do the, even beyond the statistical measures, yes, it's very possible because provision shops sell a lot of ultra-processed foods. Operation hours, they also operate some late in the night. Even in some parts of Accra, I'm told some operate almost all the night. then people can also have access to these ultra-processed foods in very odd hours. So, and that is how the association is derived. Thank you.
Thank you, Dr. Nanama. So our last question for this round, so this one was about how to reach the rural areas. So we'll go to Saint Ghana. We want to tell us how this work will reach those of our peers who are in the rural areas.
Okay, thank you very much. So with our advocacy rationale, we have adopted, we are working with civil society organizations. Some of them are mainly based at the district level. So we are going to use a lot of them to advocate in the churches at the mosque so that we ensure that we are able to get everyone. Some of them have already started advocacies in the communities as well. Thank you.
Thank you very much. So we'll go for the next round, but please let's make it very snappy. One question each. Okay.
Okay, thank you. I have a question, but it's a general question to anyone can answer this question. How does Ghana's FOP system intend to collaborate with other countries to patronize the system since you also import their products?
Thank you.
Okay, I'm Manasseh, and this is to Doc Nanama. From her presentation on measures of food environment, I think she had a point on microscan. I'd like her to share more light on that microscan here.
Thank you so much. My name is Kweja Joseph, and when Prof was speaking, she made mention of the school feeding program. So I'd like to know some of the interventions made by the government, existed ones, to promote healthy eating in schools, because like she gave the data that majority of the school kids are either underweight or malnourished in general. So although the school feeding program is ongoing, what are some of the interventions that tries to get to know the progress so far for the school feeding program? Thank you.
Thank you.
Okay, thank you for the opportunity. I want to ask what GAN is doing about hygiene, about the raw foods, because Dr. Nanama in her presentation talked about people not choosing raw foods or the unprocessed foods because they feel like it's not hygiene, like not well kept. So what is GAN doing about advocacy of eating those foods instead of the ultra processed foods?
Thank you. So, for the last question. Okay, so if you don't have anyone, then we can go ahead and answer. So sorry, get our presenters to give us their response. Okay, so the first one has to do with Ghana's intention to collaborate with other countries, right? That was the first question. So
Ghana's intention to collaborate with other countries. I think Ghana is not an island anyway. And whatever policies that we develop should fall within the international best practices, as well as the marketing policies that guides global trade. And so Ghana is mindful of some of the global restrictions as to the issues of labeling, and that is being taken into consideration in drafting some of these policies. Besides that, also, there is a leeway that you, as a sovereign nation, can have your own policies that guides how you should live and how you should thrive, which no other country can impose on yourself. So what Ghana is doing is looking into best practices internationally and also looking at the international policies that exist and framing our policies within the space of acceptable limit. So that's how far Ghana is considering these issues in its policy development.
Okay, thank you, Prof. The second question, couldn't hear you out, but then engage with Prof. So it was for Dr. Narama, so I'm sure she would answer him. Okay.
Okay, thank you. So the macro scan, it deals with describing the outlet typology in terms of the types of outlets available in the food environment and the foods they stock. So when we say the foods they stock, in terms of the type of foods, whether ultra-processed or unprocessed, and also the densities in terms of quantities. Okay, so the macro scan is usually at the broader and community level where, or let me say, the town level where we want to look at, okay, you take Cape Coast, what are the outlets available, the food outlets available, what do they sell? Okay, they sell 2 items. The 2 items they sell, what are the densities in terms of quantities available in the outlets? That's the macro scan. Thank you.
Okay, thank you, Dr. Narama. The next one has to do with what other interventions the government giving in terms of the school food environment, right? Was that your question? Was that the question? What was the question? I didn't get it.
What are some of the interventions that act as a follow-up, to know the impact of the food feeding program?
Okay, okay. So assessing the school feeding, the impact of the school feeding program. Okay. Okay. Yes, so we want to know what are some of the interventions that have been done to assess the impact of the school feeding program as we have it currently.
These are has largely been done by the universities. Quite a number of studies that have been done on the school feeding program. It's not more of a government commissioned kind of study that much, but more of the various institutions, universities, some getting funding to do research on the school food environment, or some graduate students focusing on the issues of the school food environment. That is how far some of these issues are being looked at. And I must say that we struggle with research, funding of research in this country. And most of the policies that comes up, following up in terms of tracking its what do you call it? Its impact becomes much of a challenge. One of the easy ones you can say government have focused on in doing is our Ghana Health Demographic and Health Survey, which is done every 5 years or so to tell us the state of Ghana's nutrition. But if you even look at the nutrition data within that space, the focus is on children under 5 and then mothers, I mean, in terms of adult population. And it leaves a bit of a, this year, I think they tried to do something on adolescent, school age children to adolescent. But if you look in, you don't find much of information on that sector of people as far as we want to look at their nutrition aspect. There is also the mixed survey, that is the multi-indicator cluster survey. And these gives us a bit of a picture of what is happening within the general environment. But if you want to see specifically on school feeding, I think it's largely has been done by the universities. But I must also say that there are other international organizations who have also been interested in these areas, like WFP, like FAO, who have also commissioned studies on these aspects. Some, the results are published and you can find online, but quite a number that I know of, which is a very kind of comprehensive study. The results, I don't think it's yet available for public discussion. Yeah.
I think the results are, I think that when you were presenting, Dr. Frimpong Japan was presenting, I think you mentioned something about school feeding program, some research that has been done, and you said they were mixed. So maybe you can throw a bit more light on that.
Thank you. So please, like Prof. Perko indicated, is the researchers, okay, mostly found at the universities who have monitored the impact of the school food environment. And the current data we have shows that for children who have minimal requirements. So you see, when you look at the recommended daily allowance, okay, we have age categorizations. Okay, so for children within the lower age bracket who have, let's say, lowest requirement for proteins, it shows that the school food, the Ghana school feeding program meets their requirement, but not for other age brackets. For some studies, they've also indicated that the school feeding program within their discussion sort of replace lunch that would have been provided at home. Okay, meanwhile, the lunch that would have been provided at home is far more nutritious than what is provided in the school, resulting in a negative rather than a positive impact of the Ghana school feeding program. In other places also, they found that, in fact, consuming the school food, okay, or the food provided through the government scheme is associated with high increases in vitamin and mineral intake. So because of these mixed results, it's very difficult to say how the impact is, like whether fully positive or negative. But I guess that differences will exist based on the type of population being studied, with higher impact, positive impact among children from very low socioeconomic backgrounds. Thank you.
Thank you very much. So the last question goes to our GAN rep. Please, is he around?
Let me just add a bit to the school feeding, because it is key. In Ghana, like most of the countries, we have very beautiful policies. Okay, very, very beautiful. I'm sure if you look at the policy on the school feeding, you have monitoring frameworks, monitoring evaluation frameworks, and so on and so forth. But how much of those do we do? I mean, if we're doing very good monitoring and evaluation of the school feeding program, I'm sure we would have had very good measures of impact. Okay, but I don't think that we do them. Even the caterers that are selected to feed our school children, who are they? Who does the assessment? If you belong to a certain political grouping, you are selected. It's like job for the people. Okay, I mean, now one government he has sacked all the caterers, and they are going to group of caterers that belong to a certain political group. Okay, so that's why we are not surprised that we have all these mixed pictures that we see from the various researches that we have done. So as a country, we need to take some solid steps in making sure that we have a standardized selection process, we have a standardized monitoring process, and we have a very standardized evaluation process, so that we can actually measure the impact of the policies that we put in place. Thank you very much.
Thank you very much, Prof, for the wonderful addition. So the last question goes to Gant. The questioner asks, what is GAN doing about raw food, since we are concerned about contaminations of those foods? So what is GAN? I don't know if there's anything that GAN can do or is doing. So I want to hear from our Honorable GAN Secretary.
Thank you. GANT, as in Ghana Academy of Nutrition and Dietetics, who are the professional and body when it comes to food and how it impacts our health. We are also very concerned about food as it transits from farm to our plates and everything that happens within there. So far as contamination is concerned, nutritionists and dietitians continually engage the public in terms of education, especially when it comes to food safety and how wholesome and healthy food has to be before consumption. So we believe all our members who are nutritionists and dietitians in our various health facilities, communities, and wherever we find ourselves, we are always pushing the education, and being partners with SEND on this advocacy project alone says a lot. And it is for this reason why we've held this symposium and academic engagement nationwide with the major public universities. It is all to help raise the awareness. So encouraging all of you here, even the students, to take the word out there to reach the larger populace. Thank you.
Okay, so thank you very much, GAN rep, for the answers. So currently we are on the Q&A and we are done with that. The next is for us to have a health break, but we want to apologize to those following us online due to the changes in time because the program did not start on time. So the health break will be for only 10 minutes. And as I said, we apologize to those following us online. So please bear with us. We are going for a break for just 10 minutes. We'll be back and then we will continue with the presentation. Thank you very much. Please try and get up and do some walking. It's all part of the advocacy. Walk around, talk to someone, move. Hello, please. We are about to start, so please, let's come inside. Please, those outside, come inside. We're about to start. Please, let's come inside.
Vote of thanks here. For Dr. Hannah. I don't know if you can. Dr. Hannah would like to give the vote of thanks. So after when this one will I have another I have to leave. This one. So so once you take over,
here,
this way, just continue everything.
Is it FD or who? No, wait. So, okay. So she will do it before the FDA. Before the FDA. Okay, then let's tell the FDA. Because he was really, he's going to see that one. So the one, yeah. Please, those outside, come inside. We're about to start.
Wow. All right, so welcome back from the health break. We will continue with a presentation from Dr. Marisa Makari, who is a senior advisor for Advocacy Fund, and then Dr. Adiolu Adebi, a regional senior industry advocacy advisor. They'll be doing an online presentation on global evidence of what works for food front of package labeling, warning labeling, and then so we would I don't know if the technical team is ready. Please, are you ready for the presentation? Yes, please.
Thank you so much. Should I go ahead?
By Dr. Marisa. Please, which one is ready? Okay. All right. Okay, so on the program, we're supposed to have a presentation by the Food and Drugs Authority, but the online team is ready, so we will take that one first. Once we are done, then the Food and Drugs Authority, the rep from the FDA will come. And as we wait for the technical team to get that presentation ready. And afterwards, we also have Dr. Lauren Watson from the University of Ghana, who will also be giving us a presentation. Okay, Dr. Marisa is online now. We'll get ready.
Are you ready for, thank you so much. Are you ready for my presentation now? Should I go ahead?
unmute your mic for us. Can you hear me, Marisa?
Yeah, yes, I can hear you.
Hello, Marisa.
Hi, can you hear me?
Hello, Marisa. Can you
Hi.
hear me? Your mic is muted. Can you unmute?
It looks to me like I'm unmuted. Let me leave the call and come back. You can't hear me now? No.
Yes, Marisa, we can hear you online.
Okay, great. Kingsley, can you hear me? Or LeBron? Great. Can you hear me now?
From our end.
Yeah, we can hear you now. Oh, great. Perfect. Yes, I think, so let me just put my slides in action mode. Thank you so much. See your slides.
You don't have to.
Yes, it's okay to continue.
So if I'm
Yeah, Marisa, we can see your slides. Okay, perfect. Great. So I'll get started now. But thank you so much. I can hear a little bit of background noise. I know. Okay, great. Thank you so much for the opportunity to speak. It's a pleasure to be here, and I'm sorry I couldn't join the morning sessions, but today I'm going to be speaking to you about global best practices, so based on the evidence and also implementation experience, best practices for front of pack labels and nutrient profile models. And I'm speaking from the Global Health Advocacy Incubator. So first, just really quickly, although I suspect you've talked about this in earlier sessions, but ultra-processed foods and beverages or ultra-processed products are a really important target to address with front-of-pack labeling policies because these products are harmful to health. Meta-analyses show that they're associated with 32 negative health outcomes. These ultra-processed foods are becoming increasingly prevalent in the diet and in our environments, and they're problematic mainly because, well, for one reason, they're problematic because they're high in nutrients of concern. When I say nutrients of concern, I'm talking about sugars, salts, fats, and also ingredients of concern like sweeteners. So because these products are high in these nutrients.
Hello, Marisa.
Yes.
Please kindly hold for us for a minute. We want to project your sound out, please.
Sure. You let me.
Thank you.
Hello, Marisa.
Hi, yes.
Good. You are back on air.
Oh, perfect. Okay, thank you so much. Great. So I'll just start from the beginning. So thank you so much for the invitation. It's great to have an opportunity to speak with you. Today I'm going to be speaking about global best practices on front of pack labeling and nutrient profile models. And, basing that on the evidence, the scientific research, and also implementation experience. There's a bit of background noise. I don't know if you can hear me okay.
Yeah.
Okay, so first I just wanted to talk a bit about ultra-processed products. Ultra-processed products are important targets of front of pack labeling because these products are associated with a lot of negative health outcomes. They're high in nutrients of concern like sugar, salts, and fats. And ingredients of concern like sweeteners. And they also replace the consumption of traditional, unprocessed, indigenous foods. So ultra-processed foods are important to reduce or eliminate from the diet because of the negative health impacts they have. So when we're talking about front of pack labeling, we're really keeping that policy goal linked to the reduction in the consumption of these harmful products, these harmful ultra-processed products. And I'm going to talk first about some best practices for front of pack labels. And then I'll talk about some best practices for the nutrient profile models that are kind of the engine behind the front of pack label. The nutrient profile models are the element that decides or determines what products receive what type of label, or if they receive a label at all. So first, it's important that front of pack labeling be mandatory. There are a lot of voluntary schemes out there, but we know that they're not effective. We know that when there's just a voluntary scheme in place, it's often not placed, maybe not even on a third of the food supply, or on a third of the products that should actually receive it. And often, if it's voluntary, companies decide to put it only on the products that are healthier. So they don't put it on those most harmful or most unhealthy foods, really skewing kind of what the consumer is seeing. Besides the element of front of pack label being mandatory, it's important to have a really clear objective for the front of pack label. As I said, the ultra-processed foods and beverages are important elements for a policy goal. And it's important to get your objective very clear. So objective, I know there's a little background noise. Let me know if I can be heard okay. But one clear objective for a front of pack policy, and an objective that we know is achieved by a front of pack policy, is the policy should be able to help those consumers identify those harmful products, identify those products high in nutrients of concern, high in sugar, salts, and fats, and enable those consumers to change their purchase behavior. So that's a very clear objective for a front of pack label that we know from experience, from implementation experience, it it works. You know, that goal can be achieved by front of pack labeling. And you'll see on the right that there's a lot of different types of front of pack labels. There's a lot of different designs you'll see. You'll see the warning label, nutrient warnings at the top right, health star rating, there's Nutri-Score, there's GDA or guidelines for daily allowance labels. They all are different graphic designs, and they all sort of test differently. They all have different objectives as well. One that we know really leads consumers to understand which products are most harmful and to discourage the consumption of those products are those warning labels in the upper right-hand side. And just this is kind of a mock-up of one label. This is a translation of the Mexican warning label. But just to give you a sense of what it could look like, you know, it says high or excess in is different nutrients, sodium, sugar, saturated fat, trans fat. In this case, they include calories. And it also includes what have been called legends. Contains sweeteners, not recommendable for children, or contains caffeine, avoid in children. Sometimes those are also listed as warnings, you know, octagonal warnings as well, contain sweeteners. But in this case, they're listed as legends. So this is just to give you a sense of what a warning label could look like. So we know what we're talking about. And importantly, as I was saying, those front of pack labeling policies should be based on solid scientific evidence, free of conflict of interest. So I wanted to share a bit of the evidence for these warning labels. Warning labels, these are in other graphic designs you'll see. These are also warning labels, but they look a little different than the ones I showed you previously. Slight variations, but generally the same concept. So warning labels have been shown in research to make it easier for consumers to notice and interpret what's in a product and if a product is harmful, allow for easier comparisons between products, and allow consumers to more easily identify which products are of low nutritional quality. A meta-analysis of over 100 studies found that warning labels are more effective than those other types of labels that I showed previously, like the traffic lights or the Nutri-Score. The warning label is more effective to discourage the consumption, the purchase of unhealthy food products. And research has also shown that these labels are very effective with children. So even children and young populations can identify very easily products that are unhealthy through the presence of these labels. So that's a little bit about best practices for front of pack labels. And now I wanted to go into the best practices for nutrient profile models. So nutrient profile models, first, for those who aren't familiar with the term, they're basically just a way, when you have a front of pack labeling policy, you want to identify, well, what products are going to receive a label, which aren't going to be eligible for a label. So you have to develop you have to kind of categorize the products and develop thresholds for the different nutrients and then you're going to use that nutrient profile to say, well, there's, you know, X threshold for salt. Is this product high in that threshold, low in that threshold? And that will determine whether it gets a warning label or it doesn't get a warning label. Really, nutrient profile models are behind and very important elements of all front of pack labeling policies. And importantly, these nutrient profile models serve you not only for to implement a front of pack labeling policy, but they can also be used to implement a marketing policy, to implement a school food policy, because once you have those thresholds set up for the different nutrients of concern, you can identify, you know, which products should be prohibited from being marketed, which products should be allowed in schools and which shouldn't be. And so this nutrient profile model is really a key element for a lot of nutrient policies and food policies. And importantly, a weak nutrient profile model is one that will result in a weak front of pack labeling policy or marketing policy. So it's really important to get this profile right. And so I wanted to share that the Global Health Advocacy Incubator has actually put together a position paper nutrient profile models. And you'll see on the next slide, there's a QR that you can, so you can download it. But it gives some background, some best practices based on implementation experience and scientific evidence. And what's a recommendable nutrient profile model? And I'll go through some of the elements that are important for nutrient profile models on this slide. So if you go to the position people, you'll see there's a table like this. And this table is kind of a recommended nutrient profile model that's based on analysis of existing WHO regional profile models to kind of come up with like a best practice model. And so what you'll notice in this model is that there are the following nutrients of concern: sodium, free sugar, fat, total fat, saturated fat, trans fat. And there's also an ingredient of concern listed, non-sugar sweeteners. So those are kind of the elements for which the thresholds are being developed in this nutrient profile model. Importantly, you'll also see for each of the nutrients or ingredients of concern, there's only one threshold or maximum two thresholds, really one for solids, one for liquids. This is a really simple way to implement a nutrient profile model, via a front of pack label, because there's not a ton of thresholds depending on the food category. You'll see that there are some nutrient profile models that have 17 categories, depending on what the food is labeled as, is it a small cake? Is it a cookie? Is it a cereal? It'll have a different threshold. Those become really difficult to implement, in actuality when the country is trying to identify if a product is complying with the regulation or not. When you have so many categories, they're very difficult to implement. And there's ways that the industry tries to get around those models. So we recommend one, maximum two thresholds for each nutrient of concern. And also we recommend that the thresholds are expressed in a percentage of total energy rather than expressed in grams or milliliters. Also, you'll see what's important in this nutrient profile model is you'll see nutrients of concern mentioned, but you won't see nutrients to encourage. So I'm talking about protein, fiber, vitamins, minerals. You won't see the inclusion of those in the nutrient profile model. And I'll talk about why in the following slide. But, these are just some of the main elements that are important to consider when developing an evidence-based nutrient profile model. And so going back to the idea of, the fact that in this recommended nutrient profile model, you don't see nutrients to encourage. So the reason for that is that, including all those nutrients to encourage, along with the nutrients to discourage, kind of dilutes the objective of the policy or of the front of pack label, which is really to divert the consumer's purchase and discourage the consumption of these nutrients of concern, the consumption of those products high in nutrients of concern. So it's important to focus that nutrient profile model on those nutrients you want to discourage. When you add in nutrients to discourage, you end up kind of diverting the purpose of the policy. Another reason is that sometimes when you have nutrients to encourage and nutrients to discourage, it's hard for the consumer to know what the label is telling you. For example, you'll see at the bottom this labeled Nutri-Score and it's an A. Well, does that mean it's, low in sugar, or does it mean it's low in all nutrients of concern, sugar, salt, and fat? Or does it mean that it's really low in sugar but high in salt, and then as kind of the algorithm identified that it's low? You don't know, because it's kind of like a bit of a black box, that algorithmic profile, or that algorithmic front of pack that includes both information on nutrients to encourage and information on nutrients to discourage, and kind of balances it out to shoot out like a score. It makes the consumer, it makes it difficult for the consumer to understand what that score is telling them. And the same for this health star rating, you see it's a 3.5. it's kind of like average. So does that mean that it's like really high in one nutrient of concern and really low in another? So it makes this kind of average score. You know, if I'm looking to reduce my consumption of sugar, for example, that score doesn't really tell me anything. And the same thing with the food compass, which is usually on a grade of 0 to 100, or, you know, it's a numerical score that it shoots out, but it's a combined score of a lot of different variables, both nutrients to encourage and nutrients to discourage. So if I just see one number, it's hard for me as a consumer to understand what it's telling me. And importantly, there's a lot of barriers to implementation. We have front of pack labels that have so many, they're evaluating so many nutrients, positive and negative. It becomes really hard to implement in practice. Just to give you an example, there's, for example, the Food Compass scoring system. If you look on the right, it looks at 54 individual attributes of a product. I mean, if you were actually trying to understand if the label on a product was correct, whether it was complying with the regulation or not, you'd have to evaluate, you know, more than 50 different elements, vitamins, minerals, food-based ingredients, additives. In terms of implementing, it would be very, very difficult to do that. And also because, for example, if you return to the recommended nutrient profile model, there's only, you know, sugars, salts, fats, maybe there's trans fats, sweeteners. It's very simple to look at the back of pack or the list of ingredients and to kind of do your own calculate. I mean, if you were monitoring and implementing this, this policy, it would be easy for you to kind of look at the back of pack and have all the information you would need to know if that warning label or that label on the product was in compliance. But if you had a label based on, for example, a food compass or another one of these nutrient profile models that includes nutrients to encourage and discourage, it'd be very difficult for you to even know if it was complying or not, because you'd have to do this very complicated analysis of more than 50 different products. And so with that, and this is just an image of the different warning labels that have been implemented around the world or approved. And yes, that's the end of my presentation. Thank you so much for your time. I'll pass it over to my colleague, Adeola.
Thank you so much, Marisa. I'll just project my slide. I don't know, maybe if I'm being heard. Okay, thank you. Kindly let me know if I'm being heard within the room. So this is just a build on the presentation by Marisa, which is to look at the for us to understand industry interference. Marisa has presented the key evidence that we have globally around front of pack labeling and the need for the mandatory policies and the warning labels, while they are more effective in helping consumers make the best choice in their purchases. Now we need to understand how the industry, the food industry, also position when it comes to this type of policy development. We need to also be able to understand the fact that the food industry, you know, for example, if we talk about the tobacco industry, everybody, we let you know, oh, tobacco is bad. People should not be smoking. The tobacco industry, you know, it's not all there. But when it comes to food, the food industry have also positioned over the years to be key partners in the social, you know, society development, economic, creating jobs and other things within the society. And these has, in a way, try to overlap or try to hide some of the influences that the food industry also has in making policies that are beneficial to their own bottom line in terms of profit making, and that compromises the health of the population. So there's need to be able to strike a balance when it comes to policy making to ensure that industry interference is actually minimized or reduced. And this presentation is for us to understand how the industry try to interfere with policy making, and also try to reduce the provisions within maximize their own profit. So oftentimes there's something that we call the iceberg of industry influence, where at the surface you see the tip of the iceberg, you see a couple of actions from food industry, which oftentimes around corporate social responsibility. You see a couple of food industry doing like community development activities, and when they do things like that, it's all about letting the communities or people to know, oh, we care about you, we support your development. But people see them as part of responsible also organization which are supporting community development or societal development as well. So, but beyond the corporate social responsibility are some deeper questions to ask ourselves, that beneath the iceberg, of course, there's also some engagement that the food industry does also even within the academia. Good enough, we are having this conversation within the university. There's an engagement of institutions who also try to promote some data to support the industry positioning without a recourse to what the evidence says. But beneath all these things, what the food industry tries to do is to protect their reputation and branding. They try to also influence regulation through decision makers. And they try to defend the freedom of choice. Like they tell policymakers, they say, oh, you don't need to make policies on these issues, like the front of pack labeling. You don't need to control what people eat. You can just do awareness and campaign and let people decide what to do. But the main reason why the food environment, like one of the presenters earlier mentioned about the food environment, is that we need to control the food environment, because if all the available choices that we have within our environment are not healthy, the best option that people can still choose from will still be an unhealthy food. So our regulations comes up in order to ensure that food industry are held to account. Now, reducing industry interference is not about industry takedown, but it's all about making industry accountable, the food industry accountable, and ensuring that they are not prioritizing profit over human health. If we try to do a trend analysis around non-communicable diseases within within Ghana, even within Africa and globally, we will see how diet non-communicable diseases over the years. So there's need to make the industry accountable, and to ensure that whatever that is being presented to the people is actually healthy, and even not, people have an understanding to know that this is what they are actually consuming and how it's going to affect their health. So beneath the tip of the corporate social responsibility are a number of actions that the industry also take to undermine evidence-based policy development. And one thing that the food industry also try to do is to try to regulation where they also jump. For example, if when they jump on trends, when discussions around food and human rights was trending, you see food as human rights. Now within Africa, and I know some of us will be conversant also within Ghana, the conversation around the food system, and you can also see food industry also talking about food system as something that is of priority. So we have the food industry using corporate messages to undermine policies, They talk about if you come up with this kind of policy, front of pack warning labels, it's going to have an economic impact. It will be low income. People are going to lose their job, but these are not really true. And as it has shown in many other places, and like I mentioned earlier on, there's need to prioritize public health beyond profit making, because if we look at the cost of treating non-communicable diseases, the effect even on economy, the development of our economies, we see that the cost is higher than the positioning of the industry, talking about taxes and profit-making job issue that they often talk about. So we have the issue around industry trying to also normalize donations, CSR, to cover their effort. For example, there's a community in one of African countries where a soda company actually diverted the water within that village to their production plant to produce sugar sweetened beverages. But this same company is in other communities giving them boreholes. So they are in a community where they are starving a group of people access to water by utilizing the entire water for their production plant, but they are in other places showcasing how they are digging boreholes for people to access water. So these are some of the ways the industry try to greenwash their image. They use narratives to undermine and weaken food policies. For example, as Ghana is now developing the front of pack warning labels, the industry may realize that, okay, we may not be able to stop the government from developing these policies. Then they may try to target the nutrient profile model, like that Marisa explained earlier on, to say, okay, let's try to see how we can weaken the nutrient profile model, maybe, not utilizing effective thresholds or higher thresholds, so that at the end of the day, most of their foods will appear to be healthy, or using a scoring system that might undermine the public health impact that the front of pack warning label should have. So they try to undermine and weaken food policies. They divert attention from the effect of their products and brand over that the effect of the products and brands are having on health. Today, so many ultra-processed products are out there. How many of us are still prioritizing traditional diets rather than, we talk about fast food, we talk about ultra-processed food, processed ingredients and what have you. And this is being marketed aggressively. They are also being shown as the standard of living. They're also being shown as what to show that, as a status thing. But people are, unlike, for example, if infectious diseases where maybe somebody gets infected, for example, with HIV, within 3 months, there's going to be seroconversion. You're going to see that, this person tests all hepatitis, B and C. But when it comes to NCDs, some of the diets are eating the food that we're eating, the junks and what have you, may not manifest immediately. And then in the course of maybe 5 years, 3 years, 6 years, 10 years, we begin to see the impact within the society. So they hide the damage that their food causes. Now, another quick thing that I wanted to mention around what we are also seeing growing within the African region, and of course, which is more of also the industries around the positive nutrition. Through this challenge of triple body malnutrition in Ghana, in Africa, other countries where, stunting, obesity, overweight, and there's need for people to eat healthy. But the food industry is also already positioning to be a solution provider through what they call the positive nutrition, where they try to say, okay, they are, even though this is an ultra-processed food, it has positive ingredient. For example, it's high in vitamins, it's high in fiber, or promoting, for example, maybe fortification of bouillon cubes. We know bouillon cubes are high in sodium, and then foods that are not healthy, they get fortified, and they are added with some micronutrients, which they say, oh, now people should consume them because of the micronutrient addition. So that is the idea of the positive nutrition. And the underlying factor is just a way of the food industry trying to sustain what we call corporate diet. I know there are a couple of people who are working on access to food, in Ghana, and which is all about, the need for agriculture to, improve, smallholder farmers able to improve, and people eat healthy. But the food industry is positioning for what is called the corporate diet, where people are not still moving away from ultra processed food, and but talking about, oh, they are getting extra micronutrients. So this is also kind of an industry approach that we are beginning to see, especially within the African region, that we need. As we are talking about front of pack warning labels in Ghana, we also need to be conscious of how we tighten the policy and not allow the industry to take advantage of this, because healthy diet cannot be compromised. It's kind of important. We need the less ultra-processed food that people eat, the better the health outcome. Evidence abound is out there. So how do we encourage traditional diet rather than promoting corporate diet? So this is more of the industry playbook, positioning positive nutrition to deny the responsibility of ultra-processed food. They try to achieve regulations in this regard, to talk about and affecting nutrient profile models, so that they know, yes, warning labels work, is very effective, but how can we weaken the nutrient profile model so that at the end of the day, the thresholds are not as effective as expected, whereby they have foods that are not carrying the warning labels, and people will think, oh, once it doesn't have the warning labels, it's actually healthy. So these are kind of the issues that we've seen in the playbook of the industry, how they try to weaken policies and the food industry. And because they are not like tobacco industry, people don't get to suspect or don't get to worry when they talk about some of this positioning, the brand washing, the greenwashing, and also trying to divert attention or talk about economic losses, job losses, which oftentimes they exaggerate. But regulating the food environment, like somebody rightly mentioned earlier, is very important, so that when people have to choose, they choose what is healthy, and when they are eating, they understand. How many people can really read the nutrition panel, the back of pack label, but with a clear warning label, they know that nutrients of concerns that are high. I don't need a food that is maybe too high in salt or high in sugar. Then once this labeling are there, people are able to see it at a glance within the stores without spending time to try to do calculation in their head. This is the essence of policies like this, to help consumer make informed choices in quick time. So I'm going to stop here, but, for us to understand that the industry, the food industry, have a role to play in the sense that most of the ultra-processed food we have are being produced by them. But at the same time, in policy making, we need to ensure that evidence prevail, and avoid industry interference that could undermine effective policy making. And one of the ways to do this is one of the things that is being done now by Gand and team to sensitize key stakeholders, so that we are proactive, we understand how food industry could undermine our effort, and be able to stand against it, and also present evidence and ensure that things that we are doing are also evidence-based at the end of the day, because health should be prioritized ahead of profit making. I'll stop here because of time. Thank you, and happy to take any question afterwards.
Let's repeat the question. Okay. So for clarity, I want our questioners to please repeat the questions. So we had just two questions, one from RD Eric, and then RD Eric, if you can please repeat your question.
All right, so my question was to Dr. Marisa. I wanted to find out if there was evidence for the hybrid model of both the traffic light system and then the text warning labels in terms of behavioral change. If she could make any comment on that. Thank you.
Thank you. And the second question.
Thank you very much. My question was based on the warning labels, we have some on cigarette packs and they've not proven to be very much effective. So how sure are we that putting warning labels on food products are going to be effective? Thank you.
So thank you very much. So Marisa and Dr. Diole, please if you can hear us. Over to you.
Hi, everyone. Can you hear me? It has been a little, there's been a big echo, so I don't know if I caught the questions very well, but I'll do my best to respond to what I think I understood were the questions. So with regard to the first, I think I understood if there's evidence for a combined kind of two labels on a product, a traffic light and text labels, but I'm not sure what they meant by text labels. Was it kind of a warning label? I'll just give a general answer saying that, in fact, the WHO recommendation is that there's only one front of pack label on a product. So having more than one could end up confusing the consumer. So the recommendation is that there's only one. So that would be my answer for that one. So the ideal would be choosing one evidence-based label rather than multiple, and really being very clear about what the objective of that label is. And then the second one, I think I heard a comparison being made between graphic labels and tobacco and warning labels. And I would just kind of refer back to all the evidence, or just to kind of emphasize that there has been a lot of evidence, both experimental, randomized control trials, and also sort of real world research or research taking place after warning labels have been implemented to indicate that they are the easiest labels for the consumer to identify which products are high in nutrients, harmful nutrients. And they're also easy to understand for children. And research has shown in countries that have implemented the label that they reduce the purchases of products high in sugar, salts, and fats, and they reduce overall consumption of sugar, salt, and fat after the implementation of these labels. And we can share some fact sheets pointing more to this evidence. But I hope that answered your question. I apologize if I didn't hear all the details. Thank you so much.
So I don't know if the second question was answered. Was answered. Okay. So thank you very much to Marisa and then Dr. Andiola. So the next one, okay, so we have a presentation by the policymakers on food labeling and marketing policies in Ghana. So we will invite our reps from FDA to do that, the honors. So thank you very much, FDA. Now, we're coming to hear what it means by vetted and approved by FDA. So thank you very much.
Thank you very much. Good afternoon. Mr. Chairman, I am standing on all the existing protocols. Good afternoon once again. I have my drink here, and the drink has changed my presentation pattern. This is the drink that I was served during the health break, right? Honestly, I was very hungry, so I took it. I didn't know what it was. So then, I want somebody to identify this for me. That will be the end of my presentation. Mr. Chairman, with your permission. Any volunteer? This is the front of package warning labeling and nutrition profiling models, a presentation by the FDA. Madam who prepared the slides, I'm sorry, just like Prof said, she took all her effort to present. Oh, anybody, any volunteer? Any volunteer? All the presenters have said everything. Any volunteer? I'm not presenting anything. This is my presentation. Anybody? Oh, please, a microphone. You have one. She's my friend, she's my everything. We want to identify this. We are feeding into that theme, or that's our objective that we want to achieve with this symposium. I hope, give it to the students. You are too old to identify this. Give it to the young ones. So I enjoyed this, though I didn't know what it was. Kindly help me identify this. Give it to them. It's fine. We are no alphabet identity. Medianity. We are befawi. Identify this thing, and I'm a practical person. That's why I'm not using my slides today.
Okay.
I want us to know what this is. Thank you.
I think this is fresh fruit juice, but from the looks of it, maybe watermelon fruit juice.
Thank you. Maybe watermelon or juice. Can you give it to another person, because maybe is not an identification. Obi say, ah.
So from the color of this, I would say it's a mixed fruit juice.
Thank you very much. A mixed fruit juice. So we can go on and on and on. I ate it. I was so hungry, so I ate it. I enjoyed it. It was sweet. Sugar was inside. So I enjoyed it, but I don't know what it is. So food will be anything that satisfies hunger, that I will use to satiate my hungry attitude. That is me. If you write it, process will mark you wrong. But for the sake of this symposium, anything that satisfies hunger, either for the animal or for human beings, it becomes our food. But what would have helped us to identify what kind of food we are going to enjoy? This is what I want to take you through. The law as enshrined in the Public Health Act 2012, Act 851. When I'm done, I hope you'll be able to identify what may be watermelon juice, maybe mixed fruit, whatever it is. I'm presenting on behalf of my regional head, Madam Francisca Anochi. My name is J.C. Ochre, Head of Food Safety Department. So this is the law for which FDA works to protect public health and safety by ensuring that all products are safe, of good quality, and for the drugs efficacious. When safety, what does it mean? It simply means when you eat the food, you satisfy your hunger. and nothing else. You don't get any secondary ailment. You don't vomit, no stomach cramps, anything. All you were interested in is you went for a food, you enjoyed it, or you will seem, oh, baby, why you fine? One of months you go, so come on, okay, baby. That is what we are saying. A food should be safe. For quality standards, you have to meet all the requirements that need to be met in preparing that food. So for example, if you are preparing fufu for me, at the end of the day, I shouldn't taste it and feel like I'm enjoying gari or I'm enjoying brozampesi or anything else. It should be food. Are we good to go? That's the quality standards. For drugs, I'm just chipping it in. If it is indicated to cure headache, fever, malaria, or whatever, after taking the medication, it should give you that cure, straight up, and nothing else. So, which of them is food, as per our discussion? It could be anything raw, anything as we couldn't describe, something pre-packed, or something that we love enjoying, as in the corner there. Can we go ahead? I've passed these slides. Yes, so I'm here. This is what we call food. And FDA regulates farm to fork. That is why you have the raw plantain there, up to, is it burger or some? I don't even know what that food is, but I know some chips is there that we love enjoying so much. Then some canned products, including water, is also there. And then some rolls are there for us. All these things form part of what we call food. But we have the pre-packed ones that the earlier presenters made mention of, that it seems more safer than maybe the first one, which for the ordinary Ghanaian or person, it may not be so. But for the academia, it could be. But my body MPC may stand out than all the rest that may be semi-processed or fully processed. All our foods should be well labeled so that they can be identified. So feeding into our theme or our objective for this symposium, every food should have a label. And a label could be a tag, anything embossed, printed, or anything as seen on the screen. If we had this under my product I showed, at least it will help us to identify what food is. And what is labeling? Labeling is just the text, the writings, the ABCDs, the pictures that we put on the label is the labeling. What are the labeling requirements as prescribed by the law? And the law is Public Health Act 2012, Act 851. Can we go to the other slides? Good. So for the general labeling requirements, please, my microphone should still be there. A name should be prescribed by law. The name of every product should be a name prescribed by law or by the local people. So for example, we have Gary, and I think it's originating from Nigeria or somewhere. We have Zonkom. It's coming from certain parts of the northern region. We have Banku coming from certain part of Ghana, and the name is Banku. Wherever you go, is Banku. It's accepted like Banku. So you can't tell me you are coming from US, so you have to give you a different name. It is called Banku, and it's Banku. And that is how it is accepted in our country, or the country of origin of the products. So we have the name. The name should be able to describe the product vividly, so that you don't take gas oil when you want to take water, I hope everybody was served with water, the UCC water. You see UCC, is it U splash mineral water? It just shows that it is water. That is the name prescribed by law. The other side is the brand, which is UCC has produced U fresh mineral water. Are we good to go? So the name alone should describe the product for us. And the one that I brought, I only saw the nut cuisine or whatever it is on it. Did it describe the products? Not really. But this is served under this program. Thank you very much for understanding. Then the net weight, drain weights, or volume of the product, depending on the nature. If it is a net weight, if it is very solid, you give us the weight, liquid, the volume, and then the mix can have any of them. Like shito, it could be either in volume or in the weights. Now we have the drain weights. Which one is the drain weight? For sardines or fish in medium, you have to give us the drain weight. We don't want you to sell the liquid medium, which is not supposed to be consumed, though we consume it, to the unsuspecting consumer to buy, that the thing is heavy. We want to know the weight of the fish. That's why we call the drain weight. Then the manufacturer's address and details should be on it for traceability purposes. We want to know that this water that we were served was produced by UCC and no other person. So if somebody is faking it, you still come to UCC. Then you have to prove beyond reasonable doubt that you did not produce that product, although it bears your name. The reason why we need that one. Country of origin. Where is the product coming from? This is a bit dicey. I hope my 15 minutes, you add some 3 minutes to it. The country of origin is where the product is coming from. This is problematic with FDA and our importers or local manufacturers. They just see some beautiful names online and want to copy. It doesn't work like that. The basics is that wherever the product is being manufactured, that is the country of origin. So I'm using U-Fresh water. It is made in Ghana, so the country of origin is Ghana. Now there are certain names that are associated to certain countries, and you can't go there and borrow it. For example, a name like basmati rice, it's not coming from anywhere. Basmati is somewhere, is it in those areas? And their rice has certain flavors that you can't get anywhere. So you can't produce rice in Ghana and say it's basmati rice. Because basmati rice is on the shelf as on tech. And no, you can't be given. Sultana. Sultana is the name of some princess somewhere, and they said that any rice we produce, we call it Sultana. Sultana, or I'm in China, I'm producing Sultana rice. You come and reject it. Are we there? There's another part to this. Country of origin. You can only change the country of origin when you change the products, the state of the products. So for example, you buy long grain rice, this Sultana rice from wherever, and you want to do maybe 100% broken. You change the formulation, the particle size. Now, it doesn't become the country of origin of that place, but it becomes Ghana because the change was done in Ghana here. So that is the only way you can change the country of origin of a product. That is if you change the nature of the product in question. Date markings. That is the expiry dates and then the manufacturing date. Note that manufacturing dates are not mandatory anywhere. So when you go to the shelves and you see a product without manufacturing date, don't fight them. The mandatory one per law is the expiry date. That is the date the products be good or of good quality. That is it. Manufacturing date only becomes mandatory when the shelf life depends thereon. So pick our sachet water. They say 3 months after the date of production. So therefore, you have made the manufacturing date compulsory or mandatory. Therefore, you have to produce the manufacturing date so that we can calculate our 3 months thereon. Are we good to go? Thank you. then the batch, and then or the lot numbers. Oh, I'm going, okay, I have my slides here. So the batch or the lot numbers, they are seemingly the same. One is a larger quantity, or one is a subset of the other, but they sound almost the same. When we get to vaccine production, then we are very particular with the lots identification. But for food, they sound almost the same. So sometimes you see batch number or lot numbers. What it means is that, for example, these two stretch of rows or columns are the batches of product we have produced today. So I can assign here batch A, and here batch B, so that when it goes to the market and there is a problem, or somebody reports that I bought this product and I'm suspecting this, that, or it's not tasting as it is, or whatever the information is or the complaint is, you just quickly will pick your products and look at it, go to the batch number, because it's the same data you produce. When you see batch A, then you know that it is those that were on my right side. And quality control and then the consumer complaint unit can just handle it. It is the same thing that we use for product recall. Without batch numbers, the work of the regulator becomes very difficult. So it is one of the key labeling requirements that we take. Storage instructions, that is if and only if the integrity of the products relies on the storage. The product that I brought is supposed to be stored in a freezer because it was frozen, not even in the fridge. So the storage condition or requirement must be stated, but is it on it? The one who has it? Nothing is on it. So you may buy it and put it on the shelf. You go and it has scheduled. Because that thing, when I tasted, there's smoke inside. So it's yogurt. To me, it's yogurt, not FDA. To me, I tasted and I thought it's yogurt. Right? Yes. So the manufacturer may have to come and explain what it is. Now, list of ingredients. This is everything I'm presenting. We want to do a front of package warning and labeling. And the law is saying that every ingredient that you use in making a product must be declared in an order of ingoing weights. The simple English means when you are using 5,000 ingredients, the one that is highest comes first. That is simple. So when you look at the list of ingredients, the one that is last is the minutest in quantity. But for mechanic, I say, I don't know. So when you see sugar as number one, then it means sugar time. When you see water, that is water is first. Sometimes the first, second may be equal, but you should know that as you are going to your right, the quantity of that ingredient reduces. Usually you see that the spices and the flavors and the colors are the last parts, which means they were in minutest quantity. List of ingredients is mandatory on every product apart from single ingredient products like salts, sugar, and others. Maybe palm oil, engo. Engo is engo. There's no other ingredient. However, when you are making zomi and you add salt or something, it doesn't become a single ingredient again. You need to declare all the ingredients that you use on it. So you may see water and you will not find the list of ingredients. Don't say the FDA man said there should be a list of ingredients, so I'll not drink. Water is a single ingredient product. When they carbonate it, it changes. When they flavor it, it changes because we have flavored water, carbonated water, and other things. They all change. There is something we call compound ingredients, whereby you are using a product as an ingredient. Some people will use cheese or margarine in their products. So when you get to margarine, where it is, let's say you use water, something, margarine, then you open a bracket and you list all the ingredients that was used in making the margarine before you close it and continue. That is disclosure of compound ingredients. Our language is, in simple terms, English, plus any other language. Ghana, we speak English, Anglais. So any other language you put on it is accepted. However, we should get our English that we can read. If you think you are from my village in Passetti and you want to write chi there, praise the Lord, but we still have to get our English version to get our work done. So Ghana is English. If there is no English, it doesn't mean the product is not good. Regulators may require you to do additional label that you may hang on the neck, like the picture that you saw, or you may put as an insert, which is also acceptable. So please don't go out there and fight the English. Yes, you have to be very convinced that there is no English labeling anywhere for that product. Now we have other mandatory labeling requirements. They are other mandatory. You know, some products will cause, or allergens, let me use that word. There are some products that will cause allergy when they are found in our foods. If any of such products is even in traces of your product, you have to declare them. Fish, anything shrimp, anything sulfur, anything crab, a lot of them. Sulfur. You see, those who enjoy wine, when you buy wine at the base, you say may contain sulfur or traces of sulfur. It is a mandatory requirement that you have to. Now there are others that I hope our program will be happy if it is mandatory now. The nutritional requirements or nutritional facts. That is not mandatory by the Public Health Acts, by any law. That will show you that per serving size, you have to eat this or you get this, that from it. No, it is not mandatory. But other manufacturers will think that no, my consumers need to know the quality in the bottle or in the pack. So they will go the extra mile and disclose them. When you disclose them, you have to dance to the rhythm. You have to substantiate to the regulator. You just don't go to the internet and think you are making, you see that picture there? You go to the internet and then you start picking anything and then you post it on your product. No. Anything on your label should be justified. Laboratory analysis will do. So that is the nutritional requirement. Now, other things are like this. Please, the slide that have the plantain chips. I've coined everything into years. I use this one to train the agri-tech people when they were having their challenge. This is a beautiful label that has almost everything in no order. The only order is this one. Of all these, there are only two things that should be at where they are. This, I'll explain, and then this. This is not that mandatory, right? It helps you to sell. When you have the FDA number, they say put it at where everybody will see that your product is registered with the FDA. But this one, it is supposed to fall within the principal display panel where you have the name of the products. Whenever you are going to buy any item, just check. The moment you see the product, either top or down or within the principal display panel, you see the volume or the weight of that product displayed so that they don't cheat on you. That is the essence. You know that I am buying 1 liter of this oil, 500 mils of this thing, 10 grams of that. You don't have to be turning the thing. No, it should just be here. It should always be within the catchment of the principal display panel. I hope you've gotten it. Thank you very much. Now, what are the few marketing policies outlined? The mother of them is the Public Health Act 2012, Act 851. That has all what I have said. It includes advertisements, registration of the products, storage, importation, handling, everything that you have to do so far as the food chain is concerned is enshrined in the Public Health Acts. GS, Ghana Standard 46, also helps with the labeling aspects of the work we do. LI 1541 talks about the codex labeling that we have adopted as Ghana standards is also there. We also have the LI 1667 for infant formula and follow-ups, And then we have the fatty food policy too. There are a lot of these policies. When you get to the assemblies, the local municipals and district assemblies, they also have policies for the sales or marketing of all these food products, such that everybody who is even selling should have a health certificate, selling food. You have to be screened of some communicable diseases so that you don't transfer food ailment through the food to the suspecting consumers. I hope campus you will take it on and make sure that everybody who is selling on campus will at least have the health certificate for the stats. Yes, that one will save us a lot. In all this, we have some misleading, prohibited attitudes. You will see food with something like boost immunity. No. And they originate from university campuses because they go online, they travel outside the country, they see some practices outside there, and they want to bring those foods in there. Please, for the sake of this class, food is to satisfy hunger. When you eat well, you will grow healthy. That is it. Food doesn't treat any ailments. It doesn't boost immunity. Yes, we know when you eat well, the nutrition, when you eat very well, but you can't claim that on the registration of a product or on any label. No, it is not acceptable. We had problem with people who were registering honey and moringa. You know the health implications of this and when you go online. Yes, we are all aware, but the policy says that food is food. Like I was hungry and I was given that thing that I didn't know, and my instinct told me it was food, I ate it. It is food, that's all we need. If I eat it and I start vomiting, it's me. If I eat it and I have energy to do my presentation, that is what is required of that food. You can't lay claims on anything. There are a lot of false, deceptive, and misleading claims, and others are too superlative. When you bring them, we are not going to register it, health claims. If you want to register anything food as health, register it food supplement. Notes, food supplement to FDA, it is not food. It is treated as drug. I hope most questions will come from there, but we are talking about food. Food supplement is not food. To us, we register it as under drug. Food is food, chewing gum, water, live base, anything is food. So in summary, all marketing authorization holders should make sure their products are well labeled, well registered before they put it out there. Consult with whoever, FDA, any other consultant that they think can help them get their products well registered to register for them at the FDA. So in conclusion, we are saying stakeholder engagement is a crucial way of getting all foods aligned with the policies of the states. Food safety, healthy food is our corporate responsibility, not for FDA, not for Ghana Health Service, not for the university, it's for you and I. Thank you.
Okay, thank you very much, Mr. Ochre. Food safety is our corporate responsibility. I like that statement. We'll take another presentation from Dr. Lauren Boateng, who is with the Technical Working Group from the University of Ghana. If Dr. Lauren Boateng is here, she'll come and give us. Let's welcome her with a round of applause. So once Dr. Lauren Boateng is done, then we'll ask questions for the two of them. Okay, you're welcome.
Thank you very much and good afternoon. I have a very brief duty to do and which is to present the policy pathways to the formulation of the FOPLs in Ghana. My name is Laureen from the Hello, my name is Laureen, a senior lecturer from the Department of Dietetics. So I'll quickly go through the outline of my. So first of all, you've heard a lot about the food, the front of pack nutrition labels, so much about it. So I'll just give you a brief gist on the why, the first steps that we took in developing the policy. The policy itself, the content and the structure. We'll look at stakeholder engagement and the actors who have been involved with the policy development. We'll look at the strategic objectives and actions, the implementation plan, and so on to the summary. So why the front of pack nutrition label? Now, you've heard a lot about it today, but I'll use this brief or this framework from UNICEF to try and explain. The front of pack policy gives consumers an opportunity to access easy and quick nutrition information in order to be able to make decisions. So it helps them to understand what they are choosing based on the label. Then at the same time, it also helps manufacturers to be able to understand what it is that is in the foods that they are producing for the public to consume. And that should helpfully stimulate new product development or product reformulation by the producers or the manufacturers. Now, at the end of the day, we are expecting that this will lead to consumers making better and healthier purchases, and then to improve diet quality, which will hopefully decrease overweight and obesity and the non-communicable diseases. And at the end of the day, decrease government healthcare costs. So it is intended to trigger a series of behaviors and actions that will eventually be beneficial for everybody. So what are the first steps we took in the development of the policy? First was the assembling of the various teams. Several teams have been at work on this policy. I work with a technical working group, sort of. As the work is done, it is brought for vetting, we review, we update, and so on. So we have had relevant sector ministries, a whole lot of them. We have had lawmakers, academics, civil society actors, people from many different areas, sectors, forming several teams that have come together to put this policy together. Then the brainstorming work of looking at the rationale for the policy, I think that we've had a lot of information on that today too. We looked at what exists in the global and regional space. We are not the first to develop a front of pack nutrition labeling policy. So we have to look at what exists and then pick up from the best practices. Then the methodologies, the National Development Planning Commission has a structured guideline for developing national policy. So we just followed that to get the initial draft. The policy itself has a vision, a mission, and a goal. So the vision is to empower healthier food choices through clear and comprehensive front of pack labeling. The mission is to promote health by providing consumers with a simplified, at-a-glance nutrition information that helps them to make informed and healthier choices. And then we have a set of active verbs for the goal: to educate, to inform, to detect, to protect. End of the day, to guide consumers to make healthier food choices. Let's look at the content and structure of the policy. The policy has 7 main chapters. The chapter 1, based on the background information of the policy. Chapter 2 is the legal and legislative framework, constitutional provisions that make the policy possible. The chapter 3 looks at the policy framework itself, the objectives and the guiding principles. Then chapter 4 looks at what strategic implementation can be done for the different policy objectives. Chapter 5 is an action plan for the implementation. Chapter 6 looks at monitoring and evaluating the policy. Every policy must be monitored and evaluated to ensure that it's still efficacious. Then chapter 7 looks at the communication strategy for the implementation and enforcement. So let's look at some of the stakeholder engagement and the actors that have been involved with this policy. The formulation was led by the Ministry of Health with FDA in collaboration with the National Development Planning Committee and the School of Public Health in University of Ghana via the Healthy Diets for Healthy Lives project. There's been a multi-stakeholder technical task team, that's the M3T team of different, almost every ministry imaginable has been present on working on this policy. Then consultations with consumer associations, industry, and civil society organizations have also gone on. So quickly, what are the strategic objectives or what is guiding the actions? So first, to provide a clear and understandable, accessible nutrition information. That's the first objective. The second is to prevent misleading claims and encourage reformulation by industry, like I explained earlier. The third is to reduce diet-related non-communicable diseases through promotion of healthy eating. And the fourth is to align our practices with international standards. So the implementation plan and framework is as follows. We have the Ministry of Health as the lead agency. We have FDA responsible for regulation and enforcement. We have collaboration with several ministries, namely Ministry of Trade, Ministry of Agriculture, Ministry of Education, Finance, local governments, etc. And then we have the public-private partnerships for sustainability. So looking at monitoring and evaluation and the key performance indicators, like I said earlier, the National Development Planning Commission has a framework, a guideline for drafting public policy. It also has guidelines for monitoring the public policy. So we are using their guidelines for this kind of monitoring and evaluation work. We'll look at consumer awareness and understanding. It will include actors from different sectors, academia, government, private sector. So consumer awareness and understanding, industry compliance and reformulation, and then impact on consumption patterns. Then we'll have regular reviews and updates to the policy. So how will the communication and policy dissemination be done? There will be a national launch and stakeholder engagement. Well, the stakeholder engagements are still ongoing, but officially when it's over and the draft that is ready to be released is ready, we will have a national launch and another stakeholder engagement. There'll be public education campaigns, media partnership for awareness, and integration into school curricula. So there's a whole plan in place. This is just a summary of that. So where is the policy at now? I mean, as we speak today, 7th of May, where is the policy? So I'll tell you what I know. As at yesterday on our technical working group page, the most current version of the policy was posted, and it still had to be updated with inputs from UNICEF. And then it's also going to come some government sectors for further comment. So that's where we are at now. We are in the process, but it's not ready to step out into the public, public yet. So in summary, we are on course with the front of pack labeling, and we are hoping that we'll be able to have a lot of gains in terms of reduction of NCDs, and then production from the manufacturing side, also more healthier products available, and so on and so forth. Thank you very much.
Thank you very much, Dr. Boatin, and our rep from FD. So please, we want to take some few questions, maximum 4 for our 2 presenters. So if you have any question for Dr. Boateng or for, okay, please, there's a hand up here. Please make it brief so that we can, okay.
Okay. Manasseh again. So to FDA, considering our role as students gathered here, and as future health professionals, I wanted to find what key messages we could lay out to our peers, because we didn't just come here to watch and then go. What are some of the messages we can lay out concerning food safety and labeling to our peers and then the wider student body as a whole? And then probably in future, what can we do with the messages and informations we have? That's to FDA. Then to the just ended presentation, what will also be our role to contribute to a successful implementation and promotion of the FOPNS within our communities and then future practice? Thank you.
So we'll take 5 and then maybe maximum do a second round.
Thank you very much for the opportunity. My question is for FDA. We've learned about the general labeling requirements and that if a product is brought out, you need to look out for all these criteria. But my question is, does the FDA has a setup body that assess the quality of the product? If assuming the nutritional requirement or the nutritional content is being labeled on the product, does the FDA have a setup body that assess the quality of the product in the lab to check if truly what is written there is true?
Okay, so thank you, Our Lady.
Thank you very much. Please, my question is to FDA. Please, I want to know, let's take it like Vortic. You see now they have a sachet water called Vortic, and they are franchised with Vortic. When you go to Accra, they have theirs. When you come to Cape Coast, they have theirs. When you go wherever, they have theirs. And I've checked on their sachet rubber, their rubber. When you go to Accra, they have a name on it like Mabel and Gifty. But when you come to Cape Coast, they don't have it. So when you with franchising, you also check if they are using the same water as Vortic or any other companies that are using. That's what I want to know. Thank you.
Oh, thank you.
Okay, thank you so much. So my question also goes to the FDA. So my first question is, I want to know the strategies. So what strategies does the FDA use to educate the public about reading and understanding nutritional labels, especially the FOPL? And then the last one has to do with how is the FDA balancing public health interest with industry resistance to FOPL implementation? Thank you.
So thank you. Okay, so we take a last one and then, okay.
Please, my question is to the FDA. I want to find out if the FDA, with time, finds out from the manufacturers about how they are still producing their commodities. Like when they started manufacturing, they brought it for vetting and other stuff. 3 years later, 4 years later, do they do any investigation or go back to check the quality of the nutrients in the food? Sometimes you see the commodity or a product will come to the market fresh. It's very healthy and nice. But after 3 months, 4 months, you take it and you see differences. So the FDA, do they do any checkup or first presentation? That's all. And my question is, another question, FDA must know the recommended nutrients allowance, the acceptable nutrients allowance for daily intake. So if so, why is it that a common product, one product of which they know the person will not take it for the whole day, can contain a nutrient which is even way more than the normal or a daily dietary requirements? If so, does that mean the FDA is not doing the needed investigation on that?
Okay, so thank you very much. So FDA, I think most of the questions are for you. Is that yes? So please, can you give?
FDA, right? Good. You should be repeating the questions.
Okay, so I think
because you're doing that.
the first one has to do with the key messages that we need to send out after this program to our peers.
Yes, so food safety is a corporate responsibility. Whether you are a health worker, a farmer, a teacher, once you consume food, you should also take some responsibilities to ensuring that the food you are eating is safe and in a way healthy. When you go out there to the shelves and you are picking food, don't do like I did today because I was hungry. Just make sure you've gone through at least seeing if the product is not expired. That's the first thing. If it is not bloated, if it's not dented, if it's not rusty, these petty things, the product may be active or may not have expired, but it's unwholesome because of storage conditions. So you need to check for these petty things. That's for the first one.
So the second one has to do with whether you have what it takes to authenticate the labeling that.
Yes, third one.
Okay, then the other one has to do with the franchising.
Oh, I should say something, madam. Oh, my boss said I should add up. Yes, we have one of the best labs in the world. Yes, of course. There is somebody who has worked with us here, the last presenter who attest to that. We have one of the pre-qualified labs in the world that when FDA analyzes your product, anybody in the world can also stand on it and say this product doesn't need any rate testing for reuse or for any country to accept it. So we have one of the best in the world. So you may clap for FDA and for Ghana. You are doing well. Thank you.
Okay, so the other one has to do with the franchising, where you have products that are being produced from different places.
Yes, so franchising is allowed. Everywhere in the world, franchising is allowed in all production. Phones, everything that we produce, we can franchise. Now, her problem was to whether they are using the same water. And then there was another thing. Is it the name? You mentioned some name, Efia or something on it. Yes. Looking at or reflecting on the labeling requirements I did, the manufacturer, although under franchise, you, the new manufacturer who is not Voltic, is supposed to put your contact details or your details, your facility details there so that we know, though this is Voltic natural mineral water, however, it is produced by UCC. Are we getting it? So franchising is allowed. You do not need to intentionally use the source of water that Voltic is using. So, for example, you have to get a tanker to convey the Voltic water from Accra to your facility. No, you need a source of water. When you are producing natural mineral water, then technically your water source should be a borehole, something dug deep into the ground, right? That is what we say. We don't need you to get Voltic water to produce franchise Voltic products. Are we good to go, my lady? Yes. The next
So
one.
the next one has to do with what are you, okay. How do you educate the public about reading and understanding the labels that you have?
This question, I answered how before I got up. We don't educate people reading and writing. I don't think Ministry of Education, GES is here. We don't train people to read or to write. But I'll answer your question. We go out there, just like I did. We tell the people in the language that will hit their hearts. So depending on where we are, Cape Coast here, I want to speak Tree and they sack me. So since then, whenever I'm going out and I know I'm going to do public education, I go with the Fanti speakers. Though I'm a Fanti, but I can't speak it. So I'll say, Efia, let's go. Because when you talk to the people in their language, you touch their hearts, their spirit, their soul. When you go and say it English, blah, 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 you go and they'll clap for you and they heard nothing. So we do. Our public educations are very vibrant. We do it in schools, in churches, at public places, lorry parks, wherever we find ourselves, we do public education. But we don't teach people how to read and write. We will tell you what you heard in your language. If you can't read, let somebody in the shop, or definitely there will be somebody by you who can read and write to interpret the basic things you need to know for you. That's it.
The last one has to do with, in your line of work, how do you balance public health interest with the labeling that the food come with?
Public health interest is public health interest. We work with the law. And when the law says A, B, C to Z are required, that is what you are to provide. Whatever happens beyond that, we don't consider it. We consider it at the technical side or at the board side, like this thing we are doing, right? Yes, FDA management is working on it. However, before or until this thing is accepted, this policy is accepted, right, and rectified by all the other stakeholders, we are still going by what we have. And we are not going to compromise on quality or safety of any products in question. Thank you.
The last one has to do with, how do you ensure standards are maintained over time?
Beautiful. We have a whole department that does market surveillance. And what they do is that they go out there, purchase like normal consumers. They don't wear FDA. They'll come out to the shops, to wherever they can find the food. And then they pick samples, unaware of whoever is doing it. Then we send it to our labs to verify whether the things are us. We register them. And most often we get these things done and we see a lot of these products being either adulterated or falsified. Falsification can even come from the manufacturers themselves, or somebody who is sitting somewhere and thinks that, yes, this product is selling, so let me also produce. So it can, we do a lot of this market surveillance and lab analysis to ensure that they are safe. When we see that a product is on the market registered and it is being adulterated or falsified, the bearer, the owner, I said the bearer, the owner, and whosoever has been involved in the handling will have some answers to provide to the government of Ghana.
So thank you, FDA.
Thank you.
Our last question goes to Dr. Boateng. Was, how do we contribute to the success of this advocacy?
Okay, thank you. Well, that's why you were invited to this forum, and you have now become like an ambassador of the front of pack nutrition label. So you know where to ask your questions. Then you also, whenever you get a platform, talk about healthy eating. And as part of talking about healthy eating, you can also talk about the front of pack labeling. That's the way it's done. Thank you.
Thank you very much, Dr. Boateng. So we take our last set of questions, then we'll move on because we are far behind time. So any other pressing question? Okay, can see a hand up here, then 2, 3. Okay.
All right. One of the key components he mentioned to look out for in front labeling is expiry date. Some of these products are purchased in items, not in bulk. But when you look out for the expiry date, they will tell you that check package for expiry date. Some of these two are purchased single. So how can the person know the expiry date? Also, some of these expiry dates are also written how do I call it, at the bottom of the neck, which are sometimes very difficult to see. So what do they do? Check these things. And also, there are, at clinical settings, when we engage and ask of their food intake, they sometimes tell us that they took a food or a particular item that they are natural. And on these products are written boldly, 100% natural. So I want to ask, are these products really natural?
Okay, thank you. Please, let's make it snappy. One question.
Thank you. Please, during the presentation, you made mention that, like on the front labeling, like the nutritional requirement is not mandatory. So I wanted to know the reason why. Thank you.
Thank you. I also want to find out why the Food and Drugs Authority makes alcohol legal, because I see brand advertisements on television and other things, and then they say Food and Drug Authority has vetted and approved this, and then they are taking it. Yeah, so is it that they go through the content and find out if the percentage of alcohol in it is okay for us, or why do they approve that? That's what I want to know.
Okay.
All right, thank you very much. My question goes to Dr. Boatin. I want to know what guidelines for daily amounts we are using in terms of the threshold or criteria for the nutrient to determine if it is high, low, medium, moderate, whatever we want to call it. Do we have a guideline we are following for the policy? Maybe if you can educate us on that. Thank you.
Okay, so thank you very much. That will be our last question. So please, FDA, I think this one there is all for you. So one has to do with
FDA.
expiry date. So he was asking for, because he said the expiry date, no, he said where it is written. Some of them, some come on the box. And then when you take the item, then you are told that you should check the package for the expiry date.
I hope that was a question, right? So for expiry, yes, it's mandatory, a parameter. And the law says it should be legible and indelible. That is what the law says. And legibility has to do with your lens. The law doesn't go further to say font size 12, 13, 14. So when you pick some biscuits, you really will find it very hard to read these things. Or even some of the, like you observe, others have the expiry on the neck, sometimes on the crown cork, and you can't even find it. But we as regulators will find a way of seeing it. However, this is a that is raised. I think we will give to management for management to also deliberate on it, for people to make it more legible as required. But the law as it stands now is that it should be legible and indelible, no font sizing as per the law. So I can't hook on anybody and say, Papa, the expiry date you quoted is too small. No, once it is there, you, the regulator, should find a way of seeing it. It is there. That is how the law says. But it should also be legible. So if you write it too small too, it is also not allowed in a way. But no law can let you hold on to this person to use a font size, because the law doesn't state any font. And then something was also on the different pack sizes on the label. See, the law is also stating clearly that not all the pack sizes may have all the labels. I didn't say it in the presentation. Any pack size that is 10 cm square and below is exempted from the mandatory requirements, unfortunately. So when you see toffees, And then there's this chocolate thing that is box that my daughter likes so much. Choco Milo. Every day that you buy Choco Milo has nothing on it. So the labeling is required to be on the secondary package. That is the sack or the sachet, right? That is on it. So that is the law. The law doesn't mandate them to put it on them. That's why you always see it on the bigger pack size. That is it.
So when we say products are 100% natural, are they actually
Then
100%?
it should be 100% natural. No adulteration and nothing. When you say 100% anything, and we have registered that product, then it is 100% natural. You see, these words are like semantics. 100% pure, 100% this. You see it on Annie and those things that are coming from the herbal, those things that have herbal origin. So when I write on my water 100% natural, what will you do? As a regulator, what will happen? Will you accept it or reject it? I don't know what to do. Because water, the processes it goes through, basically you don't add anything, but the processes take out something that denaturalizes the water. However, nothing has been added, so still the water is natural. So it's something else. But once you write natural, then it means that nothing is added that is not natural. What about the packaging? Because sometimes it will also interact with the package. So regulation is something dynamic, and as you are coming up, policies will inform all these. Yes.
So I think the last one has to do with why we say alcohol, or why do we approve alcohol for consumption?
Oh. It's interesting. I couldn't answer this question somewhere I went, but today I'll try and answer. You see, Prof, you said something for trade issues. Certain things are beyond some discussion, but we register alcohol. What we are doing is that every alcohol that is registered has a limit. If you want to register a rum, it has a limit. If you want to register a liquor, it has a limit. If you want to register a liquor, it has a limit. Gin, it has a limit. So the volume of alcohol in the products will be determined by the product, the alcoholic product you want to register. Wines, you can't bring a wine and say it's 42%. Whilst we know internationally, wine has a range. Are we getting it? We are not registering proof alcohol protection. You don't register that one. It's for industrial purpose, right? But every alcohol that we register, the laws of Ghana has given us the mandates to limit the levels. You see, natural alcohol, the other protection is around 80 something to 96% by volume. And you have to dilute it to as low as the 40s. There is no product that is around 50. No, they are all within the 40s. That's the highest, right? 40 down to 0. So alcohol is registered. Although you may think, or your religious background will tell you it's not good. FDA is not a religion. We are an agency of the states, and we are supposed to regulate products that the state says we should regulate. Don't come with tobacco. Tobacco, same. Alcohol, same. We are regulating them. Thank you very much.
So thank you very much. So please, for the sake of time, we want to end the Q&A session here and go to our panel discussion, which is the next item. So on this item, we want to call Prof. Prekun. He will be part of the... I'm going to come up here. Okay. So please, can you help us bring the chairs up here? So Prof. Prekun, and then we have Madam Francisca Abna from FDA. Okay. Then we'll have our rep from the teaching hospital, R.D. Eric is here. Then we also have our rep from the regional nutrition office. And then yours truly will be the moderator. So please, let's have, no, let us come forward a bit. And then I think we also have Dr. Nanama. Yeah, Dr. Nanama from Pom, please, if you are around, you are part of the moderator. Yes. And then the regional nutrition officer. You're supposed to have 1, 2, 3, 4. To 5. Who will be 5? So we have Prof. Prekun, Madam, so our rep from FDA, Dr. Nanama Frimpong, our rep from CCTH, and then our rep from the Regional Nutrition Office. No, so some of them are being represented. They are not here. No. The CCT. Please, where are you going? Yeah, so Prekun, please take your seat. Our rep from FDA, please take your seat. I think there's supposed to be one more chair. Supposed to be 5. Our rep from the regional office, nutrition office. Dr. Nanama, please, you can also take your seat. Please. Okay. FDA. Okay. Yeah. So I will not sit. I will just be here. So I'm the one moderator. I'll just. So don't worry. So let the FDA man sit there. Okay. Oh no, I'm okay. I'm okay. Yeah, I'm okay. So thank you. Okay, so thank you very much, our panelists. So I'm sure since morning we've heard a lot about front of pack. We've heard from academia, we've heard from policy makers, and then also some information on the food industry. So I want to know from our panelists, looking at the country Ghana, do you think we need a mandatory front of pack food label? So you have been in the area, some of you are in the clinical setup, others are in academia, others are also in policy. So what is your take? Do you think we need a mandatory? The other mic. Yeah, so that is the first question that we have. Do you think we need a mandatory PC for Ghana?
Well, I believe that this morning we've all heard the evidence that are at play. Most importantly, our changing food and food environment, our transitory diets, and then also the outcomes, as far as the health outcomes that we are hearing of surges in non-communicable diseases. One of the things that makes it more difficult for us, if we do not take steps to address them, is the huge economic burden that these NCDs brings to our economy as a country. When it comes to out-of-pocket expenditure on health, I tell you that if you are not lucky and you have a condition of cancer, kidney failure, and any of these challenges, you may end up selling your house or your car or sacrificing your family income to take care of yourself, and you will surely die afterwards anyway. I have come across a situation where somebody on dialysis decided that when he got to know the cost of it, decided that, oh, at least I'm old. Let me go so that I don't spend all that is left for my family. And these are not just one of a testimony. Many, many people are going through a lot. And the evidence is so clear that ultra-processed foods are one of the leading contributors to these problems that we have. So having a front of pack warning label, if you make it just a front of pack warning label, there are countries that are implementing it anyway. Quite a number of countries are implementing it as voluntary policies. And voluntary, we know, is OPA Naoye. And when the FDA director was also presenting his information, he told us that there are some optional aspects as far as our labeling is concerned. And importantly, when it comes to nutrition information, it is optional. So you may choose to put or not. It only becomes a challenge when you put that nutrition label, then FDA now will tell you to substantiate what you put there. So if you don't put, you don't have any problem with anybody. But it goes against the consumer. And it's very important that we put these up to guide consumer preferences. And importantly, not just as a voluntary policy, but as a mandatory policy that would enforce the industry to comply and also give the implementing agency like FDA the muscle to drive the process.
So thank you very much, Prof. Any other contribution from any of the panel members?
Yes, I think I would add to that. I mean, Prof has shared a lot. From our talk and the presentations, we've heard that there's evidence to support the mandatory aspects of these policies. So for evidence-wise, yes, it's a yes. But when it comes to the disease aspect, which is what, if you're in the clinical settings, you tend to encounter a lot, we are seeing a rise in almost every condition. And like Prof has said, it's when you come face to face with the cost of treating this condition, whether it is yourself, your family member, or someone you know, that is when you begin to feel the pain that comes with some of these things. It might just be something subtle, but it can just make you poor all of a sudden. And there are so many patients we've seen that it just took one health care from one member. And because of that, they've lost all their livelihood. So there's a cause for us to fight for. There's a cause for us to live for. And there's other things that come with behavioral choices. So we have something called the rational choice theory, which says that people are rational and they'll make the right choice, but then it's not always the case. So we need some of these policies to protect consumers, to help promote the health that will benefit us at the end of the day. So recent surveys we've done in our diabetes clinic, for example, shows that about 50% of the patients who come to our diabetes clinic are obese. If you add overweight, it becomes 88%. My question then becomes, what can I do as a dietitian, just one person, to help bring these numbers down? It's not really possible. So without these policies, without these health promotion strategies, we can sit in our clinic and wait for them to come. But then that would mean that we cannot solve these problems by that method. So we need these policies to be out there so that consumers can make the right choice. If people are less obese, it makes our work small, but it is great because people will be healthy and then we will be able to, in a way, protect the health of people. So that's what I want to add to this conversation.
Thank you very much, Adriaric. So because of time, we might not get all our panel members to contribute to each topic. So we just go as and when we need to get some particular panelists to contribute to a particular question, we'll address it to him. So the next thing that we want to know is that what are some of the potential gains that Ghana stands to benefit from having this particular policy being passed?
Okay, thank you. I'm Rahel Mensa from Ghana Health Service, a public health. And from where I stand, if the front of pack nutritional labeling is, the policy is passed and all that we have said is set rolling. One, as Prof mentioned, it will reduce the prevalence of the NCDs conditions that we are now recording, and it will also save money for the government. as to how much money the government spend in our hospitals. It will really save money for the government, and it will also improve the general life of the populace, and then help us to live long and be able to work for more productivity. Thank you.
So thank you very much. Okay, so Dr. Nama want to add something to that.
I will also add that the front of package label takes out the group of the population who are willing but not aware. Okay, so there are a group, okay, in Ghana who are willing to make healthy food choices, but they just don't have the knowledge and the know-how to go about it. So if we have this front of package nutrition label, at least it takes those group, they become informed to make healthy food choices, which will also be significant in promoting health. Thank you.
So thank you very much. So we'll go to our next question, which I think this one will start with our rep from FDA. So looking at our current food labeling and marketing policies, do you think they sufficiently address the challenges that we have in our food environment? Looking at the current food labeling and marketing policies that we have, do you think they address the challenges that we have in our food environment?
It's yes and no. In that, in my presentation, there were some lapses. And these lapses, I hope the front of pack labeling will address these. Some of the things are not mandatory. So therefore, manufacturers, importers, or market authorization holders may linger on that and then enjoy the free bits. So therefore, if we do this or we accept this policy, I believe that those non-mandatory issues may be made mandated and everything will be declared for consumers to make informed decision.
Okay. So as a follow-up on that question, what will be some of the required mandatory policies, or what do you think will be some of the things that we need to do to make this policy mandatory?
So making the policy mandatory may not be the question, but some of the things that are supposed to be in the policy to be mandatory. For the policy, we are going to ratify it as a country. That is why government has vested the powers in some agencies to start this. Certain indicators, certain parameters, certain labeling rules that are not mandatory. And these ones will definitely become permanent, just as the other ones we talked of. All right. So for the policy, it will be there. But the things in there, so for example, somebody asks of legibility. And then I was explaining that the law doesn't mandate the manufacturer or the importer to use any font size. Right. So if I want to hide certain things from the populace, I will just write it small. And you ask me and I'll say it's illegible. So if we come up with, let's say, a font size for maybe writing the name, font size for this is 1. Now, nutritional labeling, I said it's not mandatory in any documents. So, and you know, when they add it to them, it's additional cost to them. So if company A is not doing it, and I have to do it and incur extra cost, it means my product will go to the market and it will be expensive. People will not buy it. But when it becomes mandatory that everybody has to do it, now it will be like, it's not a matter of choice. Whatever you are producing, like my drink, you have to provide it for the regulators to see that, yes, this is declared. And consumers will make this informed decision based on whatever is declared. Thank you.
Thank you. I think Prof wanted to add something to the previous question.
No, I think he's sufficiently addressed that. Yeah.
Okay. So Prof, then the next question, I want to start with you. What will be the role of academia in this fight that we are all trying to champion?
Well, that is very important. One aspect I think is very important for academia is the fact that we are the body of knowledge and we must be seen to direct policies in one way or the other. What do I mean by that? We need to focus our research on specific issues of national development. so we can always provide the needed evidence for that. I tell you that when we worked on the sugar sweetened beverages and all that, and we're doing a bit more of the scoping reviews and all that, you could realize that there was quite paucity of information on very essential things that could drive policy. Of course, you don't need all that to come from your country. So part of it was that, okay, why don't we extend the scope of review to cover Sub-Saharan Africa so that we can still build on the evidence that is needed. So it tells us that as a country, we need strong research to drive our policies, and that is where academia stands in tall. Importantly, also, we need to incorporate in our curriculum some of these policies that are inherent in the country. I can tell you there is quite a lot of food policies in this country. Part of it, we don't even know how we implemented it. Nobody is tracking that. And government will not give money for tracking these policies, although in the policy document, you find it very nicely, the monitoring and evaluation is in there. If an organization like UN, any of the UN organizations, USAID, the bilateral organizations would not be interested in resource to, nothing is done. So this is where academia comes in. Our student research, we should be able to direct them as to what is happening in the country, what they can be interested in gathering this information. And lastly, I would say incorporation of nutrition into a training from all levels. And one thing we should know, and I always say it, that nutrition is not just one subject. It's a multidisciplinary subject area. It encompasses economics, it encompasses health, it encompasses agric, it encompasses education. So we should be able to mainstream nutrition in our trainings that we do.
Okay, thank you. But Nanama, I really want to add anything to the role of academia.
Yeah, I think that another role academia can play is to be engaged in mass media education and campaigns, because the professionals and experts have sort of left the education to, should I say, some non-professionals who are on radio stations making bold statements. So as persons in academia, and even not only academia, professionals who have, direct contact with the hard evidence, we have to be to start mass media campaigns and educations to empower people as to the role of ultra-processed and unhealthy foods and their impact on their health. Thank you.
Thank you very much. Unfortunately, we are having such a rich discussion, but time is not on our side. We've been way out of the time that we're supposed to end. So we would like to thank our panelists. Thank you very much for your contribution. And then I'm sure as and when we need you, we come to you. And then, so thank you very much, our rep from FDA, Prof. Prekun, RD Eric, Dr. Nanama, and then Madam from the regional office. Thank you very much. Okay. So for us not to waste any other time, we want to go to Prof to give us his closing remarks. So, Prof.
Thank you very much. I think we should give ourselves a very big round of applause. I believe that this symposium has really been a great success. Do you agree with me? Yes. I mean, I have learned so much, and I was so excited about the participation of everybody who was here, especially the students. The questions that you asked were so informative, so solid. And I think that all of us who came here have learned so much. This symposium, the advocacy for front of package warning labeling and nutrition profiling model in Ghana, aimed to consolidate evidence, share international lessons, and chart a clear path forward. Over the course of today, we have had experts present on various aspects, including the epidemiology, diet-related NCDs, the clinical underpinnings of nutrition profiling, regulatory design options, and communication strategies for public engagement. I believe that as we leave here, we are going to advocate for the front of package labeling, and we are going to support government once the policy is finalized to help implement this front of package labeling to ensure that the health of our population is ensured. Let me add that we don't want to see this policy rest on our shelves like many other policies in Ghana. Because in Ghana, we have too many beautiful policies compared to other jurisdictions. Beautiful policies, but they are resting on the shelves. When it comes to implementation, we don't do well at all. There are countries that have picked our policies, adopted them to their setting, and they are running beautifully with them. But what do you see in Ghana? Talk, 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 but no action. So I'm challenging the framers of this policy that when it is finalized, you need to ensure that this policy will not rest on our shelves. I thank you very much and have a good day.
Thank you very much, Prof. Please, let's give it up to Prof. So the last message is that when the policy is done, it shouldn't rest on our shelves. So this goes to all of us, to those leading us, and then those of us who are following. So the next thing is to call on our Honorable JB to give us a vote of thanks.
Good afternoon, Mr. Chairman, members of the university faculty, distinguished guests, students, ladies and gentlemen. On behalf of the Ghana Academy of Nutrition and Dietetics and the entire mandatory front of package warning label advocacy team, I wish to extend our heartfelt gratitude to the Almighty God and everyone who made today's symposium not only possible, but impactful. I wish to express sincere appreciation to our chairman, Professor Sebastian Eliason, who is the Dean of the School of Medical Sciences, for his gracious leadership and strong support for this program. To Professor Kingsley Perekon, today I don't know whether he is part of us or is on the side of UCC. He is the Vice Dean of the School of Medical Sciences and doubles as the project coordinator for this advocacy. Prof, thank you very much for your leadership. Our thanks also goes to Professor Christiana Insia Samoa, HOD for Nutrition and Dietetics Department, UCC, collaborating with the School of Medical Sciences for hosting us and helping us create an enabling space for this critical dialogue. We were also privileged to hear from several presenters, Dr. Lorraine, Dr. Nanama Frempoma, who shared various insights and perspectives on the Ghana's food environment and the policy in terms of the advocacy. To our regulatory partners from FDA, your presence proves that this advocacy is very relevant and urgent. We also want to acknowledge with deep gratitude, our funding partners from the Global Health Advocacy Incubator, GUI, Dr. Marisa and Dr. Diolo. Thank you for supporting our efforts to advocate for the mandatory FOPWL. Today marks not just another symposium, but the climax of the university engagement series. following powerful events starting from KNUST through University of Ghana, UHAS, UDS, and today we climaxed it at the University of Cape Coast. Collectively, these engagements have deepened our understanding, built consensus, and strengthened our resolve to promote healthier food environments in Ghana. As we close this phase of academic dialogue, I would like to reaffirm GAN's unwavering commitment to this cause. GAN will continue to advocate for evidence-based policies like the FOPWL, mobilize professionals across sectors, and support initiatives that place public health at the center of Ghana's food systems. To all participants and supporters here today, thank you for lending us your voice to this advocacy. Let us carry this momentum forward as we continue working towards a consumer-driven food labeling policy that protects the health of all Ghanaians. Thank you very much for your participation. Good afternoon.
Thank you very much, JB. Please, let's give it to him again. Thank you very much. So the next is for us to have a closing prayer. But after that, we want to have a group picture with our Honorable Prof. Chair. So we have a group picture here. All of us will come and some will stand down, others will be on top so that you have a very nice group picture. And then the UCC students can, what? So students of UCC, Department of Nutrition and Dietetics, you are supposed to wait behind to meet the GAN rep. So please, when we are done, don't go. Okay, so we call on Madam Ifia Mankwa to give us the closing prayer.
Okay, please, you are praying. And so, Father, in the name of Jesus, we thank you and bless you. We thank you for this opportunity to have a symposium with the University of Cape Coast. It's our prayer that whatever we've learned or heard today, we'll put it into practice and help this policy see the day of light to help improve the health of Ghanaians. We also pray for traveling mercies for those who will be traveling back to Accra and wherever they came from. Grant us traveling mercies. We thank you and bless you. In Jesus' name we pray with thanksgiving. Amen.
So please, there's found car key. So please, if you miss your car key. Okay. So please, Prof. So please, kindly come forward for us to take the picture with our Prof. Chair. And then our presenters, if you're around, Dr. Nanama, Dr. Yesu, please come. All those who are available, please. Dr. Yesu. Please, all of you come. Please, everybody come. All the students, everybody. We are all part. Where is he? Okay. Yes, so we also have in our midst Dr. Derek, the head of Community Health Department. Doc, you are welcome. Yeah, so please come. Some of you come and stand with me. So please, no, you can sit here. Prof, you see? Okay. Yeah. The short ones can stand. You won't see you. You come in front. No, go down. If you go down, I'm coming. Let me. How? So I'm coming. So please, The cute ones can come in front here so that they will not block them. The very cute ones, you see, very nice, yeah. So we can see them. So the cute ones, please come. Because if you stand here, we will not see you. So the cute ones, some can sit. Very nice. So sit. Yeah, so those at the back, we cannot see you. So please, you can come and make yourself. We still have some spaces here. Oh, you can come here, there's spaces here. This is going to be very nice. Let me hide.